4, 3, 2, 1. We are live now.
Good evening, friends. On behalf of Delhi Orthopedic Association, I welcome you all for this reverse training program. The official journal of DOA, the Journal of Clinical Orthopedics and Trauma, is a well-recognized and prestigious journal in the field of orthopedics. I thank and congratulate Dr. H.S. Chhabra sir, our editor-in-chief, for conceptualizing and initiating this reverse training program for the beginners as well as established authors, which will help them to understand the role and responsibilities of a peer reviewer and learn from the experts how to review and assess the quality of the article. This training program is one of its kind in the history of DOA, which will be conducted for 2 days. The second module is scheduled for Sunday, 29th May. I hope it will be a rich learning experience for all of us. And I once again thank Dr. Chhabra sir for organizing this training program and request him to start the proceedings. Dr. Chhabra sir. Sir, you are muted.
Thank you so much, Dr. Atul Besh. A good evening and a very warm welcome to everyone today here on this event that is being organized by the Journal of Clinical Orthopedics and Trauma. Today is the first day of a 2-day event targeted at training reviewers. Now, as Sir lightly said, reviewers are the gatekeepers of science. They contribute immensely in deciding what gets published and what doesn't. And in this way, contribute in shaping the future of science. And today we're all gathered here to learn from experts who have this incredible experience, not only in publishing in peer-reviewed journals, but also in reviewing them and being on the editorial boards of these high impact factor journals. So it's my pleasure and honor today to invite Dr. Greg Schroeder with us today. Dr. Greg Schroeder is the editor-in-chief of Clinical Spine Surgery Journal. He's an associate professor of orthopedic surgery at the Thomas Jefferson University at Rothman Institute, Philadelphia. And he's authored more than 200 peer-reviewed publications and edited a textbook. His field of interest remains spine surgery, and he has chaired multiple international spine surgery meetings over the world. So here, without any delay, I'm going to invite Dr. Greg Schroeder to give the keynote speech today, which is on what do editors expect from reviewers. Dr. Schroeder, please.
Thank you so much. It's an honor to be here. I only wish I could be there in person, but I'm happy to do it on Zoom. Okay, so today we're going to get started with what an editor-in-chief expects from a reviewer. These are my disclosures. Of course, the most important one is that I am the editor-in-chief of Clinical Spine Surgery, which is one of probably the 5 biggest spine journals in the world. So very proud to do that. And this is Clinical Spine Surgery. We're also this year we are the official journal of the Cervical Spine Research Society. And so hopefully over the next 3 to 5 years, while we're not going to exclusively do cervical content, we are going to try to transition to at least focusing a little bit more on cervical spine research. So, I mean, I think this is a great topic and a great talk because it's really important to understand that reviews are really the rate limiting factor to turning around articles. So I get emails weekly saying, hey, Dr. Schroeder, why don't I have an answer on my manuscript yet? And it's important to understand how the kind of review process works to understand why this is a problem and understand where we really run into issues. All right, so once something is submitted, every journal has a little bit of a different kind of way that it goes through right at the submission. So Clinical Spine Surgery has actually kind of made adjustments over the years. At times we were making people submit abstracts first. We kind of got rid of that because it just delayed everything. But now the deputy editors are basically looking at it and seeing if it meets qualification to get sent out. And then if it does, it goes right out. But so here's kind of what happens is we send out a invitation to review. Oftentimes they get up to 2 weeks to kind of see whether or not they will do it or not, right? Because we can't expect somebody to respond right away. So the problem is, if in 2 weeks they haven't responded, then we have to turn it around. And then now this has just delayed the process by 2 weeks. But it does, 2 weeks is a pretty significant amount. The bigger issue that we have, and so this is what I would really encourage you guys all to be very cognizant of, is as a editor, I don't care if you respond no, right? If you say, you know what, I've got a really busy month this month, there's no way I'm going to find, a couple of hours to do a nice job on this review, let me say no. I'm happy to have you say that. Respond to me, relatively quickly, say I just can't do it, and we'll move on. We do require to be on the editorial board for clinical spine surgery that you review a couple of papers a year. But so if you get sent one once a month and you only do, 3 for the year, that's fine with me. What really causes a problem though is where you say, hey, yes, you know what, I'll do it. And then 4 weeks later, you haven't done it yet, we're hammering you. And then you respond, you know what, I'm sorry, I'm just slammed, I can't do it. Because now we're going back and we're, probably took you a week to respond, 4 weeks to just tell us you're not going to do it. Now it's, 6 weeks, we still don't even have a review yet. So that's where we really run into issues. So from my standpoint, I'm totally fine with you saying no. I just don't want you to say yes and then back out. Other things that we have are really terrible reviews. So I found this review today. This was amazing. This person just clicked yes, accept, right? There's literally nothing, comments to authors. If you look at the bottom of the page, like how can I, as an editor-in-chief, send this out? It's not really a review. So now you have the deputy editor who's looking at it. He's got, 20 things in his mailbox. He's trying to go through them and look at it. And we have this. It just, it really, again, delays it because now we either have to send it back out or the deputy editor has to do it. Occasionally, if the deputy editor reads it and he thinks, wow, this is really a great paper, we'll go through and say, yes, accept as is. But I would say that in the last 5 years, probably a handful of papers, I think that is true. And, I can say I've, published, 250 plus peer-reviewed publications. Probably less than 5 of them have I ever gotten anything back that was like, hey, look, this looks great. So if you're gonna say you're gonna be a reviewer, please do a decent job. All right, so I think the big thing that you have to understand is really what is being published, what are you reviewing, right? There are all sorts of different ways that you can review. And the requirements for all of these are very different. We don't have time to go into big details about each one of these today, because we could talk for 15 minutes about any of them. But I think when we talk about primary research, this is what most people are thinking of when they think of a research paper, right? The biggest thing I want to see is, do they have a clear and specific question, right? So this is a paper that I published, 8 years ago. Is it necessary to extend a multi-level posterior cervical decompression and fusion to the thoracic spine? It was a very clear question. We had 400 patients. We had, a couple of year follow-up, and we just looked at what was the revision rate for stopping at C7 versus T1, right? There are lots of other things that we could have looked at, but this was it. And all of a sudden we got a great paper and we answered a specific question that changes the way that people manage it. Know what are your resources? Do you have a statistician? Do you have research? Are there research assistants that are doing it? Is there database? Is there funding? Right? All of this stuff is important when you're talking about as you're reviewing it, right? If a lot of the journals, I think all of them at Wolters Kluwer now require you to state that you've had a statistician read it, because that was probably one of the biggest challenges for reviewers is, as a reviewer and a surgeon, I don't necessarily know the best statistical way to do it. So we've got to make sure that somebody is reviewing this that does. Know your time frame, and probably the biggest one that I look for is being honest, right? I mean, so you have to have a little bit of a sensor in your mind when you're reading an article, like, does this make sense, right? So I always use an example that I had a paper, this was probably 3 or 5 years ago, that I was reviewing that came back and they had 300 plus 3-level standalone ACDFs. And they said they had a 100% fusion rate. And I thought to myself, something is wrong, right? These there's no way, we don't have 100% fusion rate in one level iliac crest autograft with a plate fusion rates. So how could this possibly be true? I sent it back to the author and just said, listen, I'm not sure you understand how to do the measurements. Here's the Cervical Spine Research Society's guidelines. Could you please follow these and send them back to me? I'm thinking, even with 5 research assistants, this is something that should take a week or two. Literally within a couple of hours, they sent it back to me, having done all of the measurements. And I thought to myself, okay, this person is not being honest. There is something that doesn't make sense, and I just rejected the paper. There wasn't a way that you could possibly have done this. Systematic reviews, right? If you are asked to do a review for a systematic review, you have to have the PRISMA guidelines, right? 10 years ago, I published a lot of systematic reviews that did not follow the PRISMA guidelines. That's not an option anymore. If you send something to clinical spine surgery that doesn't follow the PRISMA guidelines, it is going to be rejected, immediately. And as a reviewer, this is easy, right? You look at it and you say they made it, they didn't make it. Now you have to have some decisions on whether or not this is worth publishing. That's a whole different conversation. But I think this is really the key to systematic reviews and to understanding how to be a reviewer for these. Narrative reviews. So this is, I tell people, is a very different topic, right? Narrative reviews are kind of the bread and butter of kind of classically the Journal of the American Academy of Orthopedics surgery. These are based almost like, peer-reviewed book chapters. And I think the big thing here is really understanding when you are reviewing, who are the audience, right? There is a very different peer narrative review that is written if you're writing for the American Family Physician, which is a journal that is supposed to be easy to read reviews for the family practice physician, versus Clinical Spine Surgery, which is designed for spine surgeons, right? So if you are writing an article for those two things, you have to understand what kind of your target is, because what's appropriate for clinical spine surgery is totally inappropriate for AFP. You also have to make sure here that the topic is appropriate, right? So you want a review article on the treatment of back pain. That's not a good review article, right? Because there are literally books written on this. So how are you going to write 6 pages about it? Now, surgical treatment for an isthmic spondylolisthesis, now that's a whole, now you're focused in, you have something. And so as a reviewer, you can hang your hat on that to know what's going on. Second thing I would say is know where the article is trying to be published, know what journal it is, right? This is a little bit what we're talking about. So in the instructions for our authors, there is specific criteria that people have to meet. So if you are the reviewer and you read it and you realize that this is a case series that slipped through the editor's fingers, you just have to look at it and say, listen, this doesn't meet kind of what our basic requirements are. And if it doesn't read it, then unfortunately it's an easy review. We're going to reject this, and you don't have to go into a lot of details. It's just, this doesn't meet kind of our basic criteria. I do think understanding for primary research that the idea is really key, right? You want to have a reusable idea, and the paper needs to focus on that one idea. We talked about this a little bit before. If you have 10 ideas and you get done reading the paper and you're not sure what the primary idea was, that's a bad paper, because if you as the reviewer can't figure it out, our average reader is not going to figure it out. Okay, so let's get into some of the nitty-gritty, which is how do I actually do a review? Because I do think that this is really important. So this is how I would prefer all of my reviews to be done. All right, so the first paragraph should really be a summary. The big thing here is authors want to know that you have read their work and that you're not just throwing it out, or you're not saying, oh yes, this is wonderful. So if you read it, this part should take you, a couple of minutes to basically summarize what the manuscript is, put it into context with how it is related to the current literature. Talk about, are the goals, are they new and novel? Maybe. More often than not, it's not that they're new and novel, but it's that they either back up what is already in the existing literature or refute it. And then you want to summarize a little bit of the strengths of the paper, right? Sometimes these can be very minimal, but sometimes there are a lot of good strengths, and it's important to let the authors know that, listen, you didn't just glance at this, you read through it. The second paragraph should really be talking about major issues. Are there any major methodological flaws in this? Right. So sometimes you'll read something and you'll realize, hey, you completely forgot X, right? I mean, so if we're talking about a lumbar spine infection paper and you don't account for the patient's BMI, they can say everything else that they want, but you're reading it and you're saying, wait a minute, we don't know what their BMI was. We know definitively that patients with a BMI over 40 have about an 8 times the rate of infection as people who have a normal BMI, right? That's really important. So if you're reading it and you don't find that, this is where you kind of hammer those out. Also, are the conclusions too broad, right? It's not uncommon for me to read a paper that realistically proves one small point, and then their conclusion is like, way beyond that, talking about how this changes spine surgery forever. And you're like, no, it really doesn't. It basically tells us one small thing. Also talk about, are there any major presentational or structural issues? Basically, is it laid out appropriately? And then I think it's important to talk about, if you believe these flaws can be overcome, how would you kind of overcome these? What can you as a reviewer recommend to do? Right. So that's a big thing for the reviewers too, is it's not just here are the problems. It's here are the problems and here is how I think you can fix it. I do think sometimes you'll read it and you'll be like, there's no way that they can fix this. And that's okay to say, but then you're probably going to make the recommendation of reject. If you think there are some major issues, but you think they can fix it, then you can make the recommendation of revise. The third paragraph, I think, should be kind of more minor issues. Does the author cite the most appropriate references? I mean, so this is a big deal, right? If you write a paper and you don't really cite kind of the landmark articles, it just makes it seem like you're not sure what you're doing when you're writing the paper. So it's important to bring it in. I think one of the things that people sometimes get bogged down in here, and I think it's important for you guys to hear, is, are there typos, right? Your job as the scientific reviewer is not to catch every typo. Okay. I mean, I'm fine with it if you want to identify it, but there is basically a proofreader who goes through and corrects all of the typos and things like that. It's nice to say, hey, listen, you used the THEIR instead of THERE, but that's fine. There is somebody else who is doing that. That's not your job. But do identify anything that you think is grossly wrong. And then the final paragraph, I think, is really recommendations, right? What would you say? Is this a paper that is that, kind of unicorn of a paper that needs to be accepted as is? Is this a paper that you can accept with minor changes? And realistically, you're acknowledging, hey, listen, this is gonna get into the paper, or to the journal, but you've got to make some minor changes. Or is it one that is really revised? And I think when you give revise, I think you really have to think about what you're saying here. Okay. What you don't want to do is send somebody a paper that says revise, they get it back, they make the revisions, revise again, and then you reject it, right? From my standpoint, if I see a paper that I don't think is going to be able to be fixed, I would rather reject it. The thing that the authors hate the most, other than waiting a long time to get their first review back, is feeling like they have made revision after revision and then the editor still rejected it, because it almost feels like you're toying with them. All right, so that is kind of the all the kind of tips and pearls that I have for being a reviewer. I really appreciate you guys allowing me to be here today, and I'm happy to talk about any questions that you guys may have.
Thank you so much, Dr. Schroeder. That was very insightful. Today's session is also being casted on the OrthoTV online. And for all the viewers watching on OrthoTV, you can just scroll down on your window and there is a question and answer space. You can ask your queries or comments to Dr. Schroeder now. Sir, I have a question. As an editor,
Sure.
There are possibilities that you sometimes get conflicting reviews from two reviewers, and maybe both
Sure.
of them are good reviews. How do you deal with that as an editor, sir?
Absolutely. So, I mean, usually I allow that to be the deputy editor, or if it's me being the deputy editor, then they're kind of the deciding vote, right? So it's very easy, right? If you have two people who say reject, I reject it, I don't even think twice about it. And two people that say accept, I don't even think twice about it. But if you are the kind of deputy editor and you have revise versus reject, then I tend to read it and think, is there something that I think we can revise and change it? One of the things that I kind of hinted in there is, as an editor, one thing I almost never do is overrule like the reviewers. Like if two of them say accept, unless there is something that is really a major problem, because right, I oftentimes know who the authors are. I know a lot of stuff that the reviewers don't know. And so I want to make sure that like I follow exactly what they say.
Mm-hmm. That's great. Dr. Chabra has a question. So would you like to ask your question, sir?
Yeah, Dr. Schroeder, you mentioned that one of the main factors which determine the delay in reviewing is whether the reviewer accepts or not. So what policy does your journal follow to decide on the reviewer list? So do you have any tips on that?
Sure. I mean, so from our standpoint, we don't have a specific policy to who is on the reviewer list. We do have policies for how to stay on the reviewer list, which is considered our editorial board. I think you have to review about 3 papers a year. You have to turn in, and if you're continually turning in reviews that we think are unacceptable, then we reach out to you and tell you have to change or you're going to be off the list. If you would like to be on our review board, though, all you have to do is email either myself or our publisher. And basically, with your CV, you have to be a spine surgeon. You don't necessarily have to be a spine surgeon, but you have to be a spine care provider. You have to be an academic person. That doesn't necessarily mean you have to have a job in like a purely academic job, but we want to see that you have published some papers and you understand how to write papers and things along those lines. But there's no set criteria.
That's great. I think we could wait for a couple of more minutes for any more questions that are coming in.
Dr. Gurinder, please go ahead with the question.
Greg, can I ask you, amongst all the papers that you receive, which is the most difficult papers in your view to review? Is it a systematic review? Is it an experimental trial paper? Or which one do you think really takes a lot of time and effort? Which is to say, which one do you give to the most senior reviewers?
I mean, I think that the ones that are the most challenging, honestly, are the narrative reviews, right? A systematic review, basically, if you follow the PRISMA guidelines today and you have a reasonable question and there is reasonable literature out there, we're probably going to accept it, right? It's such, you have to jump through so many of those hoops to get there that it's pretty easy. I think the primary research articles, if you are focusing down on one specific question, most of the time people understand. But to review a narrative review basically means you have to have an understanding of the literature as a whole to begin with, because you don't want somebody to be giving a treatment on, the treatment of isthmic spondylolisthesis, which I used before, and you don't understand that there are, 3 or 4 seminal articles. So those are missed. You don't understand what the differences are. That there were treatment options that were done before that have since been abandoned, and why have they been abandoned, and things along those lines. So I think that those are actually the ones, if you want to have a high quality narrative review, I think those are the hardest ones to do. I think if you want to just have any kind of narrative review, right? I mean, there's book chapters written all the time, but we don't want people picking it up, reading it, and being like, wow, I just read 6 pages and I didn't learn to nothing.
Yeah. May I, Vandana? So carrying that question of Dr. Gurinder Vedi a bit further, he mentioned about a senior reviewer. So do you think necessarily only senior people make good reviewers, or do you think, what are your criteria of judging who a good reviewer would be?
Absolutely not. Right, the honest to goodness truth is there are some senior authors who make very good reviewers. And so I don't want to disparage those. but oftentimes the senior authors, it's just not a priority for them. They're not trying to demonstrate anything anymore, right? I mean, I always look at, Dr. Vaccaro is my boss, right? I mean, he is not doing reviews anymore. It doesn't matter to him. He's not proving it, so sending him reviews just puts me in that, delayed process, right? He's good at responding to emails, but he's never going to actually do it. Versus, some of the deputy editors that we have are people who are out of practice for, 3 to 5 years. I think that's kind of, your best target, because they still are, they're not 6 months into practice, right? 6 months into practice, they're still cutting their teeth. They don't know necessarily what's going on. But 5 years, you're really still trying to build your reputation. And so you're willing to really work hard. So I think there is a sweet spot in that kind of 3 to 5 year mark, probably as the overall best reviewer.
Greg, what's the minimum number of reviewers you send a paper to if you want to get 2 reviews?
So we maybe we should do more than this, but we send it out to 2 people, and then get them to respond and then come back. And then so that delays us. We've talked before about sending it out to 5 or 6 people. But then it just becomes a little bit more of a challenge, because, now you get 5 reviews. What do? People are upset. We don't have enough reviewers, even though we have hundreds, that we can ask somebody to have 5 reviews on one paper.
Yeah.
Dr. Rajiv Tukral has a question. Dr. Tukral.
Hi, sorry, I just wanted to know whether you have any incentivization for the reviewer process, because it's a real, what is the word for it? Rewarding process. Yeah, for many people, it's pretty non-rewarding. So do you have some incentivization?
Yeah,
that's really what will drive people.
And so there's 2 things I think that do it. And this is why I think the kind of 3 to 5 year target is what we're talking about. Is one, if you're on it, then you are on the editorial board of clinical spine surgery. I think that it is something for a lot of people for academic promotion. It is something that in and of itself is a reward to be on the editorial board. 2, you can also get CME points for it. So if you do a good job on your reviews, then we actually grade them. We have to grade them 0 through 100. If you get over a 70, then you can earn a CME point. For some people, right, that's very important. For other people, that's not important at all. But those are kind of the 2 ways that we reward people at this point.
Now, can I ask just one last quick response to a question?
Yes, sure, sir. Let's squeeze it
How
in.
much importance, Dr. Schroeder, do you give to desk rejection?
To what?
Desk rejection. Desk rejection by the journal office or by the editor before it goes to the reviewers.
I mean, so we don't. So for the kind of rejection outright, before it goes to review, they are so. Ideally, the deputy editors are supposed to basically scan and make sure that it meets the minimum criteria. If it meets the minimum criteria, it is supposed to go out for review. And I will say that the bigger issue that we have is actually sending too many things out for review. But it should never get rejected. If you are a level 1, 2, 3 study with at least 50 patients, you should be able to get it sent out for review. And it bothers me a lot when it falls on either one of those. And I will occasionally get people who send me an email that say, hey, I sent this, we met the reviews and it just got rejected. I don't like that, because I don't want one person to have that kind of power. And I think that there's a reason that we have a review process.
Excellent point. Thank you so much, Dr. Schroeder. That was a wonderful presentation and a good interaction followed by that. Thank you. And I think we don't have any more questions. If we do have questions, we'll get back to you. Let's continue with our session today. Thank you so much, sir.
Thank you. Have a nice one.
You too. So For the next talk today, we have Dr. Gregory D with us, and the panel discussion that they are going to have is about the qualification, the ethics, and the benefits of being reviewers. I think Dr. Bedi has been a part of JCOT for a very long time. He's a senior consultant and director of orthopedics at the Fortis Hospital, Vasantkunj. He's trained in the UK, where he worked with the Williams Harris and Roger Atkins for his foot and ankle training. He's had fellowships from very reputed places, and he's authored, reviewed, and been on the editorial board of journals. So very happy to have you here, sir. So I'll hand over the next session to you to talk about the qualifications, benefits, and ethics of being an elite reviewer.
Vandana, is my screen visible?
Yes, very much. Please go ahead.
Okay. Thank you so much, Dr. Chawla. Thank you so much, DOA, for organizing this new reviewers training webinar. I think it was really required that we sit down now that the editorial board has undergone a sea of change. We got a lot of new people who've come in, and a lot of people have now expressed their interest to be part of the elite reviewers group. And it's really heartening to see the number of younger people who've actually come in, and it was good to have people come in and contribute more and more. I have been given the onerous job of actually sitting and discussing some of the aspects of peer review, and to my delight and happiness, I've got two very eminent people who will be with me. I think Dr. Anil Jain requires no introduction. He's been at GTB Hospital almost ever since its inception. He was part of that team that took over along with Dr. Tulli. He's been involved with publication in the Indian Journal of Orthopedics for such a long time, and not only that, he's done the Indian Spine Journal as well, and he's been a deputy editor for the JBJS. He's authored many books. He's written many papers. A very, very valuable part for Delhi Orthopedic Association, and one of our pride and jewels of Delhi Orthopedic Association. Dr. Jain, thank you so much for being part of this conversation. My other colleague on this is Karthik. Karthik has been, I think if you guys followed up a lot of work which came out on COVID-related issues, Karthik and Dr. Raju Vash almost sort of steamrolled the whole literature which was there on COVID and its implications in orthopedic practice. Karthik works in UK in Southport and Ormskirk District General Hospital. He's been associated with the Apollo Hospital Education Research Foundation. He's been teaching at the MCH course in the Edge University. He's been with the Royal College of Surgeons faculty. He's been actually very, very active even in the JCOT editorial board. So I welcome you, Karthik, as well. We've known each other for a while, and so we'll have a very fruitful discussion. Remember, this is just being done more as a conversation, and we try to make it look as if everybody doesn't exist except three of us, so we keep the conversation as light as we can. So briefly, we've got three sessions going for you this evening. One of them is being an elite reviewer. The second one is on a comprehensive checklist for reviewing articles. The third one is very, very interesting. It comes from experience. We're talking to a lot of stalwarts and what they can impart for us in terms of reviewing articles and looking at articles, and maybe even some help in picking the gems out of these articles. So briefly, we'll be in this part, the first part of this, we'll be talking about why peer review is essential, the significance of peer review, the responsibilities that come for a reviewer who takes part on this. There's a small report on how we can actually prepare a write-up for a peer review as well. But remember, there's going to be a lot of duplication in this because that's the way it has been structured. So there's a session next Sunday. I hope all of you will be there for the next Sunday session, because again, that's got very interesting talks as well. So can I now call in Karthik and Dr. Jain? So Karthik, can I ask you, why is peer review needed? Why do we make so much of a fuss about peer review journals, and why have the peer review journals almost got an elitist stature in the scientific community?
Thank you. Good afternoon from sunny Warrington here. Thanks to be on the board. I'll jump straight to the point. I think peer review process is the fundamental of any reputed journals. Peer review is a process on which all academic articles are validated, judged, checked for their integrity, checked for their authenticity. And for any submission that comes across to a journal, we need peer reviews to validate that content. Does that article look publishable? Does what it's trying to tell us is valid? Or is there a lesson that I'm going to learn from that? So these all factors have to be inculcated before an article gets published. Now, how do we judge this validity of an article? A person at the editorial board, a deputy editor, editor-in-chief, cannot be the single person to judge that. And that's where a peer review process comes into play. So I think unless you have a peer review process where the peers of the author who has submitted the article reviews that article, validates its content, and says, look, this chap has submitted something, we should be a benefit to all of us. And that it's going to enrich the knowledge that we have and support patient care. Because ultimately, remember, all of us are publishing articles to improve evidence-based knowledge. And depending on that, you are going to improve patient care. So all the articles that get published should have this scrutiny. So if that is what I think peer review is necessary, and therefore we need more peer reviewers to help us do that.
I think that puts it very, very well. Essentially, we need to ensure that there is a proper procedure why something has got published, it has been validated, the significance of the paper has been looked at. There is some amount of originality in the work, which is the reason why it has been printed. So I think, there's definitely no doubt about it. Peer review is an essential process for any scientific publication, and rightly so. They have actually withstood the test of time and are pretty much the most sort of sought after thing when we talk about publishing journals. So, Dr. Jain, can I call you in at this time? Any other reason in your mind that peer reviews have actually sort of taken over most of the scientific world, and how you would think about when you've been reviewing journals for a long time, you've actually authored the Indian Journal of Orthopedics for such a long time. Anything else that you would like to add regarding the significance of these articles?
Thanks, Gurinder, and thanks everyone. I think we'll have to, the science has evolved on the basis of research publications. And this published article is going to be an evidence which will be available far and wide and to everyone. And this evidence which is going to be published is going to stay beyond the human life, beyond the author's life. So now that article, that evidence is going to be part of basis of new research done on the subject. 1, 2, that article, that evidence is going to be part of all meta-analysis, systematic analysis, which will take place in the future. So it is necessary that evidence which is published should be robust. And that is why it is very important to have a third person's perspective to know about the article, to increase the decision base of editor by adding peers, and third, ensuring that whatever is published, the evidence is generated on concrete data and not the eminence. And that is why probably peer review becomes one of the most important things, because the published article is the foundation for future research.
Absolutely. I think, Anil, that's very well put. So, the significance of this for the future generation, for a future person who's going to do research, for looking at anybody who's going to use this evidence is immense. So the stress on the reviewer is not by any means a small little sort of element of the process. He is actually taking the shoulder on his burden to carry this research further if he agrees that it is worthwhile. And a lot of people in future will quote this research, and you need to be very careful what you pick up and what you think is the right way forward. Dr. Jain, can I ask you, just give us a very brief and a very quick outlay about the, how the peer review actually takes place. We're talking about a paper has been submitted to the editor. What next?
Now, see, whenever the papers are submitted to the journals, generally they are screened at first instance by the publishing team. That do those articles, as Greg also said the same thing, that if the article is reached to the editor's desk for decisions, then it means that article is has the all ingredient of a properly written article as per the journal format. So if the article is written as per the instructions to the author, has all ingredient of or subdivisions of the manuscript as far as the type of study designs and everything is there, and then the publishing team thinks that this article should proceed ahead with the review process, then the reviewers are allotted, and generally that depends with the journal to journal how many reviewers will be allotted. If there is a sound, robust database of reviewer, just allot 2 reviewers, and you generally give them 3 to 5 to 7 days based on the journal to reviewer to say yes or no, decline or accept. If both the reviewer accept within 5 to 7 days, then 2 weeks further are given for reviewers to respond and give the review. Generally, most of the journals, they give a little email a few days before the expiry of the 3 weeks for just a gentle reminder. And then once the review is submitted, then authors starts taking decision whether the article is going to be accepted or whether article needs improvement, will go for the revision, or article is rejected. And that is how in 3 broad category this will generally come. And I think good peer review process should finish this much in about 6 weeks time, so that author knows within 6 weeks time that article is accepted or in the revision process or rejected. So this is the general policy of the all journals to handle the review process.
Dr. Jain, tell me, if you send something back to the author for a minor correction, when he sends it back, what's the process? Where does the paper then go to? Same reviewer, a different reviewer, and a different associate editor? Or what's the norm for this?
See, if the reviews has raised valid methodological issues or valid questions by the reviewers, then it goes to the same reviewers. However, if there are not, they are just minor revisions and they're not, then even the editor can take a call that, well, these concerns have been addressed by the author, and the editor can take a decision. But I'm sure if there are serious methodological or any other issues raised by the reviewer, then ideally they should go to the same reviewer back for validation, whether, or for their opinion, whether they are happy with the revision by the author. I think here I would like to say one thing, that if we have sent for one revision, then all that is required should be done with the manuscript. It should not be a repeated revision. For example, good journals, they always do a plaque check also, and they provide to the author that this manuscript, these are the comments of the reviewer which are encouraging, and you have to revise as per these comments. However, at the same time, you have to look into this plaque check report, and if there is any changes required because of higher plagiarism data percentage. In that case, there are certain so once a revision is submitted, it should be complete in all respect. And if I look at, because now for last 2006 to 2022, there are a lot of changes have taken place in the manuscript handling systems also. Well, in the 6 to 12, 13 for Indian Journal of Orthopaedics, whenever I used to send for revision, I also used to have a look at the manuscript to add some more comments which the reviewers have missed. I mean, there may be some issues which reviewers have missed. So I used to put on those prospective, those manuscripts which are likely to be accepted, put some comments then and there also that these are editor's comment. Please address these also in the revision. So that if one revision is done, means the manuscript, and if that is satisfactory, then the manuscript should be in a acceptance stage.
Sure. But you would hardly ever send it twice for a review, right? You just send it, essentially most people would just take one review and say, cancel or accept. Am I right when I say that?
Most of the time, good reviews are good enough. But
no, what I meant is for revision. For revision of a paper.
Yeah, most of the time, if we have included the comments of the reviewer, we have included other shortcoming by the editor in the manuscript and the plaque report, then generally that revision should be good enough to make a decision on the manuscript.
Sure. Karthik, can I pick your brains on identifying reviewers? So you got a paper sent to you. It's a spine paper, and you are the associate editor, and you've been told to find reviewers. What do you go through? I know we have a database that JCOT has a database of all the reviewers, and you can actually go subject and a specialty wise, and you say spine. What do you look at in terms of the spectrum of the review?
So my thought process as a quality that I would like for an article to go across to a reviewer are few simple. I should probably know his or her specialty interest. I should not be sending, say, a specialist who is in a foot and ankle and sending him a review to review a spine article. It's not fair. Maybe by my previous experience, I know this chap is fair. He is transparent. He knows his own limitations because I've had communication with him prior. He says, listen, the article you sent me, that's not my specialty, and therefore I can't do it. I'm very happy with that. Secondly, he has to be timely. So if he sent a review and he accepts it, probably it's pertinent on the reviewer to be timely and communicate. So therefore, that is the key principles I would look into a reviewer. Further than that, I think he should be a person who is able to critique an article better rather than being critical. Shouldn't be someone who is personal. It should not go on to a personal line. He should, if he is aware of any conflict of interest, then maybe he knows the authors who have submitted the article. He should be straightforward and come back to you and say, listen, I know the first author who has sent this. I can't judge that. And I would like that because that shows the honesty in that. So I would pick all these criteria into this.
Karthik, do you think geographical diversity is something one should look at? If it's a paper from Delhi, would you like somebody from, say, Chennai or Mumbai to look at that paper? Would that something be in your mind, or something from somebody from overseas?
Yes. And specifically, say, for example, if it is a condition which affects not only India, but say other low medium income countries, I would like some thoughts from them as well. For example, send it to Africa. You see a lot of tuberculosis there. You see a lot of Indian tuberculosis in India. So if you have an article which has been submitted on tuberculosis of spine, it is pertinent that you ask person in North India, South India, and also other low medium income countries as to what their outlook is. What do they are going to learn from this article?
Dr. Jain, does age ever fit into the criteria that you would like to for picking a reviewer at all? Is that something? I can tell you my experiences. I just cannot get a senior person to do a review for me. I don't know how you.
I think it is not the seniority, age-wise seniority, but it is rather the person, how big, how busy the person is. Now, I'll give you one example. When I attended one of the Bone and Joint Journal editorial board meeting in London, and the one who did the highest review in that year was Professor Kleinerman, who had retired. So, which now it was his interest in that year when I attended that meeting. So it all depends on person to person and interest to answer. But all those people who are on a busy chair, generally they are not able to do the justice with the manuscript, and they pass on to some of the younger colleagues. So the best is, I fully agree with the Karthikeyan, that I think you look for this someone who is already 5-year plus with the qualification and who has some credential, who have demonstrated his interest towards published by some research publications, has some as an author or a researcher, and maybe some interest in one particular subject. Suppose it is spine, then it has to be spine, or maybe foot or any other area, depending on that. So you categorize those reviewer into the subject areas, and that is how the reviewer database is to be arranged to be useful.
I think that the database is the absolute essential. You get the database right, you will get a proper review process, but you need to get the database right and keep correcting it if there are some errors which creep in. So this is just for the editorial board. It should be, the transparency is a very, very important thing. If you're dealing with scientific journals, you need to be very, very fair, very transparent, very ethical in all your dealings. Every author should know that his paper has been given a due respect, has been reviewed, and as Greg said, summarize the paper when you write it first. So it gives you a clear idea that at least he was given a fair hearing. Whatever you decide after that is something. So Karthik can ask you, what are the basic essentials you expect the reviewer to do? I'm not talking about the details or something. What is the sense, in your opinion, should he have done before he writes a review for a paper?
I think the basic criteria for one, if you ask me one single, he has to be fair and transparent. That's the only key element I look. When I do an article, I don't know sometimes the authors who have submitted because it's blinded. Doesn't matter.
Quite right.
So look at it at an open mind. You should know the author's guidelines in which the article has been submitted. Look at it fair and square. See for any discrepancy. Does the question he's asking make sense? So from essential things that I would expect from a review is, it should be timely, it should be fair, it should be ethical. Read the Cope's ethics for peer reviewers. Beautiful document it is there. It should be on time, as I keep on going that, because that stops the article being reviewed and processed in the journal. The authors who have submitted are anxious. What's happening with my article? So that's their pride. So be timely. If you can't do it, say I can't do it. So that they can send it to some other things. Be fair and critical in pointing out how they can improve the article. If they can't improve, reject it. But if you feel that they can improve, give those comments. So those comments have to be in critique, not in a personal sense of way. And obviously, communicate with the journal. Communicate with your editor-in-chief. If you feel there is a plagiarism content, let them know. Listen, there is something fishy about this. Let them know, and then they will look into that. I think this is the key. So you need to know structure, fair, critical, timely, and prompt. Communicate with your journal. Thanks.
Dr. Jain, tell me one thing. Often sometimes the authors will set a suggested reviewer. Now, in this country, am I right in saying that most people will write their friends as suggested reviewers, or am I wrong in my perception?
I think that vary with the journal to journal. There are open review policy. There is a double-blind review policy. Now, most of the time, journals follow double-blind review policy where the identity of the manuscript is not disclosed, and the identity of reviewer is also not disclosed. Fine, some journals, they do ask for name of reviewer, suggested reviewer, but it is hardly a good way to give to them, because then again, the same conflict of interest, whether known or unknown, that comes. So I think wherever I have worked as editor, I have never gone for those reviewer which the author, I've never asked for a reviewer from the author. It is the journal database that has the list of reviewer, and we decide who is the best for that manuscript. But I think to my mind, 5 answers should be given by the reviewer. 1, what is the need? Is the manuscript has need for the study and research question? Is it a sound research question? 2, what is the study design? Is the method on the describe that study design? A study has been done as per that study design. 4 is the observation which has been drawn to draw conclusion. They are robust, they are sound observation, and they are good enough to draw the conclusion, and the difference in the outcome is significant or not. And the last, the conclusion, is it answering the based on the evidence, based on the observation, and not it's different than the research question. So to my mind, if these 5-6 things are answered by the reviewer, then it's a very good review, and that really helps the editor.
Can I just add out here for people who are setting off? I mean, looking at the COPE guidelines, looking at the Wiley guidelines, they're an absolute beautiful thing. I think if you can request, Vandana can actually send it off to you. They're actually very well put in terms of exactly what Dr. Jain and Karthik have said. So a review process is not a very difficult process. You just need to have those questions in your mind. And I think if you check up, Karthik has a template in which he sets these things out. And these 5 questions get covered very well in terms of, what is the research question? Did it get answered? Is there a data to actually correlate with this kind of stuff? So it's very, very simple if you actually put those questions in your mind and keep answering and writing underneath it. Works very well. Very quickly, Karthik, on an average, how much time does it take you to review an article? A very rough idea.
1 hour. So
Anil,
if I put my associate editor hat on, when Professor Dr. Chabra or Dr. Vaishya, Professor Vaishya sends me an article as an associate editor, I read it first. And as you mentioned, I have 6 templates on my laptop. 1 for case report, 1 for systematic review, 1 for original article, 1 for... So these are the templates. And I have 10 questions on each of these templates. If I am happy that the IRB ethical consent is there, IRB, then it goes to peer reviewers. Otherwise, I send it back to Dr. Chabra and Dr. Vaishya. I pointed it out. Professor Vaishya will tell you later. One article sent about last month back was a complete duplication of another article already published. So I highlighted it to him and he picked it up. So if you ask me honestly, 1 hour. That's it. I made the decision by that time.
Dr. Jain, what did you say? How much time does it take? I think Karthik is being fairly realistic. But
I think if it is your own subject and then I don't think it takes more than an hour. It's you are able to, you just make a good read and then you start in the second read, you start finding out the correctness of it.
Karthik, very quickly, we're going to run short on time. Why do you think anybody should become a reviewer? Very quickly, very short, snappy answers.
I will give you some bullet points. It's a hugely rewarding task. In my life, look at me. It has helped me being on an editorial board, both personally. I write my articles better now because I have reviewed them. Then it has helped me academically. I am on editorial boards of multiple journals. And professionally, because I have been an editor, because I have published, because I have peer reviewed, I get Publon credits. I get certificates which are useful for my appraisal. I have to do, as you all know, we need an appraisal every year. So I have evidence for that. And over 5 years, that acts as a revalidation schedule for that. Now, once I become a peer reviewer, I know how to critique. I've been appointed as a poster judge. Yesterday, I went for the MCH auth poster presentation. Now, there are 50 posters there, but it doesn't take me more than 15 minutes to know, okay, is this display right? Has he put things in the right place? I can critique it very well. It's a very rewarding thing to do. We all know the significance of peer reviewers. So we should enhance, maybe increase the profile of being a peer reviewer. It's a rewarding endeavor, I feel, apart from writing articles.
Dr. Jain, very quickly. I'm sorry, I know I'm running short on time and Vandana is going to shoot me. So when would you actually sort of straight away look at a paper? That's not for me. Give us some pointers in which you will straight away say a red line or not for me.
I think when it is not in your area of expertise. And then probably one should politely say that I'm not the correct reviewer too. And second, if you are already working on the similar subject, and if you know that similar work is going on, then there is a definite conflict of interest, then one should decline.
Okay.
To my mind, these two are good points.
Karthik, why is timing such a crucial thing? I mean, because you get wild, you get mad getting all those emails coming every day, running out of time, 2 days left, 1 day left before the review process gets completed, kind of stuff. Why is timing such an important thing for an editor?
Because you put yourself in the author's position. I publish a lot. my anxiousness after a week starts beginning. Or why are these people not responding? So you have to put yourself in the footstep of the authors. So if you are an author, you will know the person on the other side who has submitted an article at least wants to know what's happening. So whether you reject or don't reject or ask to revise, that's a different matter. But they like to be known, okay? They have taken the trouble sometimes 6 months, 1 year in preparing that article. Therefore, timing is crucial. If that answers the question. Put yourself in the author's shoes.
Dr. Jen, anything else you would like to add to this? This is the last question.
Absolutely on the spot, because the author has taken all the trouble of preparing the manuscript. So I think we should be kind to the author, and if we have to maintain his interest in publication, then we need to be timely responding to it. And author must know within 6 to 12 weeks whether this article is publishable or not. And that is why most of the journals, most of the indexing agency ask, what is your submission decision time?
Oh, okay. Okay, quite right. Quite. I think that's a very crucial thing which came out when Greg was talking is, if you're not going to do it, say no now rather than 2 weeks later. And I think, Dr. Dan, Dr. Chabra, Dr. Raju Vash, they've been through this. They get tired of just, waiting and people not responding. I'm sorry. I am one of those who's not been responding very quickly. But guys, thank you so much. Really wonderful session. It's so good and so easy having two such senior people with me. I really appreciate your effort. Vandana, back to you.
Thank you.
Thank you so much, Dr. Bedi. That was an insightful session. Yes, a lot of questions answered, but I think the new reviewers or the authors who think that they can be potential reviewers but don't know where to start or how to start. So I think a lot of questions answered there. There were a couple of questions from the audience coming from OrthoTV. One of them was related to accountability of reviewers and about conflict of interest. And I think we covered one of them in our talk. Can we just talk about how can we deal with conflict of interest if you've published with the first author in a previous article and you are now asked to be reviewing that author's next article? Should you accept or refuse to review now?
Karthik, what do you say? It's a very interesting take on this.
I think Professor Vaishya has put in a couple of comments.
He's put in a
now,
couple, yes.
Conflict of interest will only come into play if an author has submitted from your own institution or someone you know. But if you have worries, concern, listen, this may be something, be honest with your EIC. Tell him, listen, I'm not sure about this. Let him make the decision rather than you worrying about yourself. So again, key is honesty here. If you feel there is a conflict of interest, say to the EIC, say, listen, I don't feel comfortable with this. This chap is my peer, is my ex-professor. I don't want to either comment or refute and back out from there. It doesn't matter. You can, if you are honest and transparent, that is fine. No one will say anything about that.
That's true. And I think an open communication with the editors who know the situation between reviewers and authors is important. So communicate with your editors whenever you have a dilemma. Thank you so much for this session. And if there are no more questions, I think I'm going to move on to the next one, which I'm moderating. And just give me a second. Yes. The next one is about the comprehensive checklist that reviewers should have while reviewing an article. Just give me 1 second. And yes, so we're going to talk about how to review individual sections of an article. And for those who don't know me, yes, I'm a PhD and a postdoc. My interest is biomechanics, and I'm working on various government-funded projects and collaborating with many institutes in India and abroad. I'm currently an associate editor at JCOT, and I've had past associate editor experience in Brazilian Journal of Physiotherapy as well. Today, we have two very invited guests with us who have a lot of experience with wearing the hats of an author, reviewer, and an editor. The first one is Dr. Kambhampati B.S. Srinivas. He is a senior orthopedic surgeon, and he's also the editor-in-chief of the Journal of Arthroscopy and Joint Surgery. He's the associate editor of IJO, JCOT, and JASSM. He's authored multiple articles. He's the faculty of IJO and JCOT organized scientific writing meetings. He has also been, he's organized scientific writing meetings supported by the IJO at various other conferences, and he's a previous member at JCOT. Thank you so much for joining us today, sir. And we also have with us Dr. Ujjwal Devnath, another senior orthopedic surgeon whose area of interest is spine surgery and has worked in reputed university hospitals of UK. He has authored multiple articles in peer-reviewed journals, and he's also an associate editor at JCOT, IJO, and other journals. Thank you so much for being a part of the session today, sir. And without further delay, I think I'm going to jump into asking questions to both of you. The first one, I think I'm going to ask to Dr. Srinivas. What should you know before you accept an article? And I think you've published an article very recently in another journal, so I would want you to answer, sir. What should you know before you accept an article? Hello.
Good evening, everybody. I would like to thank JCOT for giving me this opportunity. Thank you, Dr. Vandana, for the question. Yes, we have recently published on this one. We published on checklists for reviewing manuscripts with Dr. Karthik Vishwanathan and Professor Maini. This was published as an editorial in Indian Journal of Orthopaedics for those who are interested. So coming to the question, what should you know before you accept an article for review? The basic thing is to know the scope of the journal. Usually when one gets a manuscript, they are screened by the editor, and it is very rare that a reviewer gets a manuscript which does not fit into the scope of the journal. But sometimes some can get slip through actually. So know the scope of the journal, and they should have some basic working knowledge of the subject that is being reviewed. So as Dr. Karthikeyan has said, if you're a spine surgeon, obviously you should be rejecting or declining to review articles on other specialties. So the other requirement is have a good English and grammar, and knowledge of information about what information goes into each section of the manuscript, like introduction, materials and methods, results, discussion, conclusions, and references. We'll be discussing about this in subsequent sections of this course. And the reviewer should be aware of the author instructions. It actually helps a lot. If you know the format of each of these, the format of the tables, figures, word count, and the style of the references, it doesn't take much actually to go through the author instructions of the journal if you are going to review a manuscript for a journal. So I would advise reviewers to just go through the author instructions to see what exactly the journal is asking the authors to do. And awareness of the types of manuscripts, the different types of manuscripts that Dr. Schroeder had mentioned before, and how to review them. Each type has different style of reviewing. There are different points for each type of manuscript that need to be considered. So the reviewer should be aware of.
We're going to have another session next week, which talks about these details of how to review individual different aspects of a case report versus a systematic review versus an original article. Yes. And I have put your reference here on the slide for others to pursue. There is a good table, in fact, in that article, which talks about all these details of what should you know before you pick up that manuscript and say yes about it. Dr. Devnath, what would you want to add to that? And I think I'd put this question also, is how much time would you take Dr. Srinivas, what's an average time do you think you take to review an article?
For me, as an associate editor, I do review the manuscripts that come through to me. Sometimes they are very fast. Case reports are very fast to review, especially the short ones. So you can do a review in say half an hour, 45 minutes. But sometimes it takes longer. Some of the revisions, especially when you have long comments from the reviewers, and you are going through a revision of a manuscript, it could take long, maybe 1 hour, 1.5 hours, couple of hours. It's variable. There are studies which have said an average of 45 minutes is a good time, up to 3 hours. If you go more than 3 hours, generally the performance of reviewers goes down, it seems.
Yeah, yes, in fact, the British Medical Journal published about the time taken on an average by reviewers, and the median time was close to 2 hours for most. So I believe that when you take up that opportunity to review an article, you need to be sure that you can spare that amount of time to do a good job of reviewing. Dr. Devnath, would you like to add your comments to it, sir?
Well, one thing I must say, before somebody writes a paper, already they have got a form in the mind that I'm going to publish this in this journal, because they have done the study and they have found the scope of the journal where they want to publish their study. So they have got everything in order to write. So once they have written, they send it to the journal and thinking that, well, this should be well accommodated by the peer reviewers and give a proper suggestion and get a good review. Sometimes the article is so well written, you don't have to do anything. It gets accepted immediately, which is 1 out of probably 50 papers, as I have noted from my review process, and which gets only a few errors and things like that. But there are a lot of papers which are very written in a lot of different angles, but they need to be reviewed and reviewed and reviewed before they get accepted. If the journal wishes that this paper is acceptable in our journal for publication and the research is good, then we help as reviewers to get it correct and get it formatted the way we want it so that it can be published. So these are the few things which the authors should know.
It should be worth improving. That's when you request a resubmission, yes. So I would like to continue with you again and ask you, is there an order that you follow? Because I believe most manuscripts have these sections of an introduction, materials and methods, results, discussion, conclusion. So is there an order that you follow while reviewing that you can help with?
Of course, we have to follow this order only, the way the paper is written, because introduction is the main thought process which goes into writing the manuscript, where you get a good idea of the current knowledge in the field of the study, number one. Number two, you convey the gap. The author conveys the gap in the literature and set up the need for this kind of current study. And does this address the goals or hypotheses of the study? And if there are some few, 2-3 references for the current study to be supported by previous study. So this is important to know, because we have to find out if this introduction is sufficient to get on with the next stage, which is material method or the material methods here.
I'll just stop you there. So yes, it tells the story, the introduction. What I also wanted to point out with the earlier question was most people read the title and the abstracts initially, but people want to review that at the end because they are telling the crux of the article. So keep your points about the title and the abstract till the end, till you've read the whole of the article. And does the introduction tell the story, what you don't know, what you know, and why do you care to know the gap? I think it should answer all those questions. The introduction has to end with a purpose statement, as you rightly said, yes. Is it very important for these papers also to have good hypotheses at the end, testable hypotheses, and with the direction?
In the introduction, one must put up the hypothesis so that what you're looking at in the results, the conclusion should be properly framed in the introduction.
Right. So that's good information for authors and reviewers, that after the purpose statement, do describe your hypotheses at the end. And the references which you're citing should be the recent ones. Dr. Srinivas, please share what details you think are important that you should never miss out while reviewing the materials and methods section. I think the most technical aspect of the paper. Can you please share, sir?
Yeah, in my early early career, one of my teachers, we've been taught to review manuscripts. You need to know answer 4 questions basically. Why has the author done the study? How did they do the study? And what did they find? And what does it all mean? So the why question is answered by introduction. And how did they do the study is answered by the materials and methods. So there are a list of questions for any type of papers that will include who did the study. And this is anonymous in most of the papers for reviewers since they are blinded reviews. But we have got a reasonable idea of what type of setup the study came from. So when was the study done is another question, and where was it done? Who are the sample population? Sometimes part of this information is given under the results. So how did the authors do it? So the techniques involved, if it's a new technique, they have to describe in detail. And if it's a already established technique, they can just give the salient points. And what did they use to do the study? All the equipment used along with their details, and are sufficient. You just need to make sure the sufficient details are given for each of these questions.
Right. I think the details are required almost as if somebody were to replicate that study. The person should be able to do it with that amount of information. So this is some information that I've put in together, some things which need to be there to avoid desk rejects from the journal office or the editor office is the ethical approvals and the informed consents. If you have human subjects or animal subjects, depending on how your study is designed, those details are very important. From the sample details, the number, the sample size calculation that needs to go, and is also, I think, very important, that needs to go in the methods section. How are you collecting the sample, the process of sampling and randomization, your inclusion, exclusion criteria. I think all of those things are very, very essential, especially for an original research article to be there if your methods section needs to be strong. And when it comes to methods, actual procedure of what the subjects do, I think it's one of the most non-creative part of the article. It's very technical. You just mentioned all the details that go in there. Would you agree, Dr. Devnath?
Yes, of course. Very important to get the statistical analysis beforehand, because this is part of the study, is one of the most important issues which we face as authors to publish, because if we don't have a good part of the study, then no point writing the paper, because it may be experimental paper, it may be a descriptive paper, but every one of these, or analytical paper, everyone needs a part of the study. How many participants has been included from the general population, and what is the criteria that you're going to use for your successful outcome. So these are important issues which we need to. But sometimes, you find it difficult to get the part of the study, because previous studies, you make the part of the study from accessing the previous study, right? So if you don't get a previous study similar, then the part of the study to get is very difficult. So we have to get very near study towards this kind of new study that we are trying to publish, so that we can get some amount of information about the power. So that's where the fallacy lies.
Right, and we do have a statistical section next week coming in, which should be very interesting for answering such kind of questions as to when do we do power analysis, and if we don't have adequate power, or what is post hoc analysis. I'm sure we'll answer these and many more questions next week, I'm sure. Let's talk about how to review the results section for any manuscript that you read, sir.
The results, this is the first section that an author should write before they go on to write the introduction or material methods. yeah, they should have some idea about the methods, but the result section is what we're looking at properly to find our answers in the discussion as well as the conclusion. So it is the middle of the study or middle of the paper, which is the most important. You know, the results should be easy to read. That's very important because you have to have short sentences towards writing your results, and you should refer to your graphs or your figures or your tables in the results, so you don't duplicate writing the whole results out. So this is very important because then you should not have any interpretation, or it should be matter of fact. Whatever you're getting, you just put in there. So in a very informative and a very systematic order, because this is what you want. This is the age of the patient. This is the number of males versus females. This is the number of years that we have followed in a clinical paper, followed up these patients, and these are the final outcome. And we had done this procedure so many times. And if there's a comparative study, then we measure the comparison analysis, do that in between, and then go on to find out the answers from the comparison, or if it is a single outcome study, just to do the answers from that, and then use a flow charts if it's a big study. That will help towards finding what a thought process have gone behind logistically to get the answers that you're looking for.
Right. I think one of the major policies papers have sometimes is the lack of continuity in the hypotheses that they start out with, the methods that they describe, the statistics that they describe, and then the results that they present. So make sure that there is a good continuity between what you started to do and what you're presenting over here. And the biggest part about results section is also looking at the graphs and charts. The pictures are worth more than words. We know that. What are the important checklists for these, Dr. Srinivas?
I think an awareness of the author instructions for these, and sometimes actually quite frequently the authors give more number of tables and figures and charts than is required. So then actually the journal can accept, because they run into pages. So they have to reduce the number of tables and the charts. So the other information that should be included in the charts should be, are they conforming to the instructions? Check the scientific content and the format and the style of the charts. Is there a legend for the chart? Is the legend appropriately given? And does the chart or graph make any sense? And is it labeled correctly? And do the numbers tally with those mentioned in the text? And do the numbers add up? And these should be kept as simple as possible and not use too much of color and complicate.
Right. In fact, this is a nice website, and I found some ideas which how not to make charts. I think people tend to make very fancy 3D charts, and they add a lot of what we call as chart clutter, and don't make it easy for a reader to read. There are many journals which allow figures to be seen by the people who would not have access to the complete article. They can only read the abstract and see the figures. The figures should stand on their own. Do not use abbreviations. Do not use background colors like these. Do not use, choose the right type of chart. I think people, there are so many options available, and people don't know about it, or they make mistakes in choosing the correct type of figure that they could possibly present the data with. So again, very good points about all of these. So coming out to the creative part of the article, the discussion section, which gives the author some academic and creative liberty. Is it true that authors have that liberty there?
Yeah, plenty of liberty there to have their innovative thoughts in every, at least there should be at least 5 to 6 paragraphs where they can think and form the results and create that aura around the readers that this is the answers we are looking for, and this is the way it has to be logistically arrived at. So what we are looking at in a discussion is to have the results, not repeating them, but to correctly interpret the results in every paragraph, whatever, suppose we have 5 options of presenting our results, 5 different directions. So all those directions can be put up in each paragraph so that we can get a relevance or significance of the findings that we have for each of the aspects of the study. And each has to be supported by statistical as well as clinical significance. If it is a clinical paper, then clinical significance is more important, and also describe the minimal important change that has led to you from this important paper that we are publishing. It has to give that idea about the minimal, in the outcome process, how much change it has been able to put up with, so that it is properly acceptable by the readers that yes, there is some change, and so we need to put this paper in our practice. So this is very important. So that has to be properly described in each of the paragraphs. And then you compare with the past studies. Yes, you include at least some more recent studies around last 5 to 10 years, which is what most journals are looking for, because we're going back 30 years ago is just anecdotal. We can do it in the introduction when we want to. So, but most of the time in the in a discussion stage, we compare with the people who have already published in clinical stage studies, and we find the either the difference between that study and ours, or there is a similarity between their studies and ours. And then we find and write a paragraph on what are the limitations we had. Most commonly, the limitations are the number of participants in the study, right?
Is that a limitation, or is that a fatal flaw, sir? A low sample size, a type 2 error?
Sample size. Yeah, it is a limitation for all of our clinical papers, because we do putting up a study in a small institute with so many, suppose 30 odd paper, certain surgeries which we are doing, and which may be related to one particular aspect of the orthopedic science, which again becomes very limited. It's a very limited type of clinical outcome that you're looking at. You're trying to publish your own data. Right, but if you have
I think the amount of interpretations that authors make from a small sample size is something that the authors need to be careful about, and I agree.
That's right.
That all
That's
of
why
our limitations.
Nowadays, lot of
how do you interpret it? Yes. Can I take a quick question from the I think Dr. Sarat Chandra has been raising his hand, and if you allow me, the time is about to be closed. Dr. Sarat Chandra, can you please ask your question for a wrap up the session, sir? Yeah.
I just wanted to add about the discussion, whatever has already been told about. I think the discussion itself has undergone a sea of change. So the discussion that we are expected to give in journals nowadays, especially for a higher impact factor journals, is something which is totally different what we used to give earlier, or even for lower impact factor journals. Most of the higher impact factor journals want a very, very compact discussion. They do not want the authors to dwell upon all the history, what has started. They want the author to come directly to the results and speak directly about the relevance. So just to add this, when we published a paper in New England Journal of Medicine, which was a randomized trial, and it's been quoted as the top 10 articles of NEGM for 2018. So our discussion, we had initially started off with something like almost 1,000 words or something. And finally, we just came down to 100 words. That's it. They wanted a very, very compact discussion. And if you look at the first description of DNA by Crick et al. Yeah, Watson and Crick, you'll find that the discussion is hardly, half a paragraph. And the whole paper is just one page paper. That's it. And that's the basis on which they won the Nobel Prize. So I would like to say that the definition of discussion itself is changing nowadays.
Right. Thank you so much for that point, sir. Yes, I'll quickly wrap up. We're running out of time, so I'm just going to quickly wrap up the other parts for the reviewers to check when the references have to be accurate, they have to be inclusive and recent, and reviewers do point out if the authors have missed out on an important reference article. And going back, as I said, going back to the title, abstract, and keywords, I think it's important that the title is catchy, complete, but it is informative as well. The abstract, if required, structured or unstructured, should be built that way, and the reviewers can point it out. It should include all the study details, and do not make conclusions in your abstract which are not supported by the study. I think I think review articles where the abstract conclusions don't match the study conclusions because they're hyperinflated in the abstract. So I'm just going to ask you a couple of questions, regarding how the titles should be. Are you okay with titles being questions?
Yep.
You can just say yes or no. Yes. So this is the JBJS article, in fact, which asked, does a particular treatment give you better visualization than the other one? And it was a question format of a title. Titles can also give results, which was very interesting. This one said that the thoracic motion remains the same at 1 year. So the result was out there in the title. Or in patients with a particular cervical radiculopathy, or there are 3 types of treatments, the treatment did not differ. So I think the results were also out there in the title, which makes the title catchy, which was very good. Sometimes the titles describe the entire methods, and they're very wordy, they're long. But following the PICO format, yes, you should have a detailed title there. Only for nature and science do we keep very short titles, which are just limited to 96 characters. But otherwise they're there. So quick question to both my panelists: the sources of information for reviewers to make these checklists. So what would be a good place to get the checklists?
Well, you have the paper by Dr. Khamapati. That paper has got everything that is required.
Right. I'm just going to add to that as well. Dr. Khamapati, what to add, sir?
Yeah, there's a website that you have posted, actually. Equator is a good site to go to. There are also other sites like COPE, ICMJE, and World International Committee of Medical Journal Editors, or Council of Science Editors, or European Association of Science Editors. These are good websites to go to get the get information on reviewing, as well as, and also you have a reviewers hub by Elsevier as well as Wiley. These are good websites to learn about reviewing.
Right, great. I would also add to those lists are Mendeley groups, public groups, which have journal clubs. I think I learned a lot about reviewing from other people reviewing in journal clubs. So I'll just wrap up my session over there, and I'll take a few questions which have come from the audience or anybody from the panelists over here if they want to ask a question. Before we move on to the next one, we are slightly running over time. Okay, thank you so much.
There's one question, one night from the OrthoTV. Do we need a PhD degree to be a reviewer?
Do we need a PhD to be a reviewer? You need to be an author of an article in a peer-reviewed journal, but you do not need a PhD. Anyone else wants to come in there, sir?
I agree. You don't need a PhD.
Great. Thank you so much for this very informative session. I think it will give the reviewers a very good insight on how to review individual sections of the article. And do look out at Consort, Stroke, Prisma, and all of the checklist guidelines already available out there. Make yourself aware about those. Thank you so much, Dr. Srinivas and Dr. Devnath, for the informative session. And we go on to the next one for this. I think it's also one of the most interesting sessions that we're going to have. It's about learning from the stalwarts, because we have with us a team of experts with us. And I would like to invite Dr. Chhabra. He needs no invitation. He's the editor-in-chief of the Journal of Clinical Orthopedics and Trauma. He's the chief of spine surgery and the medical director at ISIC. He has published immensely over the years, and he wears the hat again of the editor, the reviewer, and the author with ease. I'll hand it over to Dr. Chhabra now, sir.
Thank you, Vandana. Can everybody see my slide?
Yes, sir.
Yeah. Thanks, Vandana. I'm also looking forward to this session because I'm looking forward to learning from the experience of the stalwarts. And we are lucky to have two very eminent stalwarts in the panel today. Of course, my predecessor, Dr. Raju Vaishya, who still continues to be an editor-in-chief. He specializes in joint replacement and arthroscopy surgery from Robert Jones and Agnes Hunt Orthopedic Hospital, South Vestry, and Royal Liverpool Children's Hospital, UK. Past editor-in-chief of JCOT and chairman of IT, E-Library and Web Resource Committee of the Indian Orthopaedics Association. He has more than 300 research-based publications and several chapters in the textbooks to his credit. He has established a center for ACI at Apollo Hospital, New Delhi. And his areas of interest include 3D printing in orthopedics, cartilage regeneration and restoration techniques like autologous chondrocyte implantation. I can go on and on, but I'm also getting his support wholeheartedly after having taken over from him. And I'm sure I will have his continued support. So welcome, Dr. Raju Vaishya. I also welcome a very dear colleague of mine, Dr. Sarat Chandra, a fellow of UCLA, Los Angeles, fellow in spine from Cleveland Clinic, faculty 1000 International League Against Epilepsy, alumni San Servolo Summer School for Epilepsy, Venice, Penry Fellow, Wake Forest University, North Carolina, USA, faculty subcommittee for consensus for pediatric epilepsy surgery, International League Against Epilepsy, president-elect Asian Epilepsy Surgery Society, and editor of Neurology India. He is the professor and head in Department of Neurosurgery at AIIMS, and he has various areas of interest, including study of various biomarkers, receptors in abnormal epileptogenic areas. I can go on and on, but we know Sarat as a very dear colleague who has a vast knowledge. And with these two stalwarts joining us, we would take this discussion forward and take their views. They say that the peer review process is considered flawed because it is time-consuming, expensive, inconsistent, biased, and abused. How can we improve upon the process? So can we have Dr. Raju Vaishya first give his views in this regard?
Thank you, Dr. Chabra, for a very elaborate introduction. I think certainly review process need to be strengthened. And the first and foremost thing for any journal to do is to build up the database of their reviewers, who should be dedicated, honest, and subject specialist. They must also be very conscious about timely review, that is, that they provide the reviews within time, and not only provide reviews in time, but also with good comments about the strength and weaknesses of the article, and also give the author suggestion how this manuscript can be improved. And I must also say that the journal and editor-in-chief should know who are the regular defaulters, and one should not waste time in sending the articles for review to these people, so that the editorial process remains efficient and the authors are also happy.
Thank you, Dr. Raju Vaishya. Dr. Sarat Chandra, do you have anything to add to this?
Thank you, Dr. Chabra. So Dr. Vaishya has provided excellent comments. Now, as an editor of Neurology India, which happens to be the oldest journal for neurosciences in India, it's about 53 years old and has an impact factor of, I'm kind of giving an introduction because many people from the orthopedic side may not have an idea of Neurology India. And not to boast about myself, but I have published more than 500 papers, including papers in Nature as well as NEGM. And it's not a reason, the reason why I'm telling is not to boast about myself, but to kind of explain the experience that I have gone through myself, which can be sometimes very, very harrowing, both as an author as well as an editor. So I feel that the peer review process currently definitely has major flaws. And that is something we constantly come up in our journal. So we have to send peer reviews to at least 7 to 8 people. And finally, we get a reply from only 2 or 3 people. And that is what we put it across. The problem is twofold here. Now, if we have some excellent peer reviewers, in fact, one of my best peer reviewers has reviewed more than 1,000 articles. The problem of sending an article to somebody who does it regularly is it's as if you're punishing this reviewer, because this person has been so sincere. You're again and again sending more and more articles to this person, and at the same time, people who don't review, or don't do the review properly, again there is an issue that you won't like to send it to them. The problem here is that the reviewers are completely blinded, so nobody knows who the reviewers are. Secondly, peer reviewing doesn't carry any kind of weightage for your promotions or for your academic weightage in an academic institution. If you publish papers, yes. So for instance, even though I have over 500 papers, I would have peer reviewed more than 3,000 papers, but that would never come out. It's more of and peer reviewing a paper is a very, very difficult task. If you want to really review paper properly, it will take you at least 3 to 4 days. So I think and plus, there is no, this is something sensitive, but bottom line is there is no monetary remuneration for peer reviewers. Now, if you look at the whole system, again, I may be talking about something very sensitive, but sometimes we have to take the skeletons out of the cupboard. So if you're looking at the whole journaling process, the authors who are publishing the paper, they're working very hard, completely free of cost. They're publishing a paper. The reviewers, again, are reviewing it completely free of cost. They're spending at least 3 to 4 days of the busy time to do a good peer review. And who is earning at the end of the day? It's the journals who make a huge money. So once the paper is published, it's in a good journal, you have to kind of pay $30 or $40 just to access one article. So I think this kind of commercial remuneration is kind of skewed, which has to be taken care of. So I think in the future, this is going to become a big challenge, because less and less people are becoming hesitant to be part of the peer review process because it's becoming too much of work. So in future, Publons, there is an article, there is a website called as Publons, which is trying to bring up the weightage of peer review so that it is trying to make people who are reviewing also visible in an academic forum. So I think in future, peer reviewing has to be considered as, it has to be considered as important as writing a paper, because that's a paradox. The persons who are peer reviewing are assessing people. They're examiners for the people who have written the paper, and they never come out in open. Nobody knows who has peer reviewed. Nobody knows what type of peer review has been given. Nobody knows what is the quality of peer review which has been given. So I think in future, there has to be a method by which people who spend time for peer reviewing, they should also come out. For instance, this person has peer reviewed 1,000 papers. That should also carry weightage for most of the academic forum. So yes, this is going to be the challenge in the next couple of years. Number of reviewers, are going to be more difficult to find. Good reviewers are going to be more and more difficult to find. And these are the reasons what I have elicited here. Thank you.
Thank you, Dr. Sarath Chandra. So we need to improve the review process, and this publication mentions that we need to standardize procedures, open up the process, or blinding reviewers to the identity of the author. So there are two views in this regard. Reviewing protocols, training reviewers, being more rigorous in selecting and deselecting reviewers, using electronic review, rewarding reviewers, as you mentioned also, providing detailed feedback to reviewers, and using more checklists. So this is what is there in this publication. Coming to the next question, what are the characteristics associated with high quality reviews? Or in other words, what are the characteristics of peer reviewers who produce good quality reviews? So Dr. Sarath Chandra would come to you first on this question.
So thank you. Thank you for asking me these questions, because these are the challenges we face day in and day out. The first thing not to do for a reviewer is not to answer back in 1 or 2 lines. It's very, very frustrating for an editor when they find that the reviewer has written, paper is good, maybe accepted, or paper not properly written. That is the first thing which should not be done. Second thing is that the reviewer should not get into the humdrum of spelling mistakes, about the quality of grammar. Often I find that most of the reviewers spend a lot of time saying that this spelling mistake was wrong, this grammar was wrong, this was not good. And they try to put down the quality of the paper in view of the grammar and the spelling mistakes, which again is not correct. In fact, some of the best papers we have got initially had a lot of flaws in grammar and spelling mistakes. Yes, they should be mentioned, but they should be weighed down. Most important thing for what the reviewer should mention is the scientific content of the paper. What the scientific content which has been made, was the study, was it a really high quality study? For instance, randomized controlled trials have the highest quality of impact factor. B, were they answering a definite scientific question? Was there a question which has been answered? Most often we find that papers, they don't get anywhere. They start with something, they say we present. So at the end of the day, you don't find as if some kind of question has been answered. So the best quality reviews will be when the reviewers can pick up whether this scientific question has been answered or not. C, it's important for the reviewer to have some idea about the statistical knowledge, because when we have larger studies, the more complex the statistics. And in case the reviewer is not able to do that, he can ask the editor to get a statistical review done. So this would help again the reviewer to send it to a statistical review. And for every editor, I strongly suggest that there should be at least a bunch of good statistical reviewers to go through, because the bigger the paper becomes, more the sample size, bigger the sample size becomes, more complex will be the statistics. And often it may be beyond the wavelength of the usual clinicians, especially surgeons, for us to understand these things.
Thank you, Dr. Sarachandra. Dr. Raju, can I put the question to you in a different manner? When you look for reviewers, what are the characteristics you look for when deciding that you would get a high quality review from them?
The reviewers should be subject specialists. They should be doing regular reviews that you can check, for example, on the Scopus website, how many reviews they have done, how many times they have declined review, how many times they have not responded, and so on. And the reviewer should provide good and elaborate comments, as Dr. Sarath also said, not one-liner. And their decision should be logical in nature. They should avoid bad languages. They should avoid any biases. They should also not propagate their way of thinking or their research into comments. And they should provide reviews within the time frame of the journal. And these are all the characteristics of a good reviewer, as far as I think.
Thank you, Dr. Raju. I would just go through some evidence and publications in this regard. This paper mentioned that younger people with training in epidemiology or statistics, as also mentioned previously by our panelist, and experience of being on an editorial board, make good quality reviews. This other paper mentioned that younger people from top academic institutes and people known to editor are those who produce good quality reviews. But characteristics that did not affect the quality were gender, area of expertise, and academic rank. So academic rank may not be an important factor in this regard. And of course, more time spent on a review yielded better results, yielded better reviews, better quality reviews as per this publication per se. So coming to the next question, we are still in the midst of the COVID pandemic, but we know that over the last 2 years, it saw a rush to publish articles. Some very reputed journals also faltered in this regard, so we are aware. So this is where I want to look at the experience of our experienced panelists. What were your experiences for publishing during the COVID times? So could we have Dr. Raju Vaish first?
Yeah. I think COVID pandemic has seen an exponential rise in the submissions as well as publication related to COVID articles and sometimes non-COVID articles also, because the authors had plenty of time and empty mind to think about their research and time to publish. Since it was a new disease, not much was known. People were doing a lot of guesswork and presumption and publishing very fast. Even publishers were under pressure to publish COVID-related article and make it free to everyone because to increase the knowledge and to bring out treatment solutions, for example, for the public. And that was good, like corticosteroid, for example, use of corticosteroid was done that way. But all COVID publications were like time-bound publications. They readily lost their value and relevance if you do not publish in time. And we have experienced that we published about 100 articles related to COVID in 2 years. They all had very high citation impact because within 2 years, you would not believe that 3 of our articles got more than 500 citations, which never happens in lifetime in conventional orthopedic or neurosurgery or other subject related specialty. So these were some of the uniqueness about COVID related article. But as you said rightly, a lot of articles were fabricated and had to be retracted later on because of wrong data, wrong presumption, falsification of data, and so on.
Yeah, thanks, Dr. Rajavesh. Dr. Sarachandra, I apologize. I missed noticing that you had put up your hand during the last question. So first you could add to what you wanted to say there and then come to this question.
Yes, one of the things I remembered about which the reviewer should not do is, often I see some really senior reviewers who kind of try to pressurize the authors to include their articles also. So they say that, I'm very disappointed to see that the author has not published this very important article, and they will cite their article. This article should be included. So again, this is something the editor should always read the reviews. And wherever he finds that the reviewer is not doing a fair job, he should feel free to correct that. So this is one important thing what I wanted to mention. And then, of course, all the other points has been very nicely covered by Dr. Vaishya. Now, regarding our own experience, Dr. Vaishya has covered everything. I don't have anything much to add, except I would like to say that COVID has put us in a very, very dynamic scenario. So the articles which we thought are very, very important initially are absolutely of no importance as of now. So if you were to read through the articles which we had published in the early days, we find most of the articles were actually wrong, scientifically wrong, and they shouldn't have been published. And many of them are absolutely irrelevant as of today. And they have become more or less of historical interest. So when one goes through it, one finds that, things are sometimes, for instance, in Neurology India, we got together with everybody around the country and we published protocols of COVID during surgeries. And nowadays, as of today, if you go through that, we find that it's impossible for anybody to follow those kind of protocols. So the lesson, what I can say is, whenever we have a dynamic scenario emerging, it's very important for the journal to wait for some time, see what is actually coming out, and then only publish the relevant articles. So there are few articles backhand, I wish I had not published them. Because when I go through these articles now, I don't find them very relevant, and I also find that they were not actually well written. But we were in that pressure of trying to understand this disease, and we were in the pressure of trying to publish as many articles as possible. So maybe that is where I would say that, yes, we made a slight mistake there. So that's what I wanted to add.
Yeah, thank you, Dr. Sarachandra. I think science, what is relevant today may not be relevant tomorrow, right? But we also have to look at the relevance today, because when COVID struck, nobody knew anything about the disease, and what was relevant then may not have been relevant now. But I believe whenever one would publish, one could have put in a disclaimer that this is a dynamic field and it is an evolving process, and the say science behind it may change in the future, and that needs to be taken into consideration. And we also published in the Indian Journal of Orthopaedics and had put this disclaimer in this regard. So so that comes that brings us to the next question. What are the criteria for desk rejects? We know that desk rejects could take place at the level of the journal office or at the level of the editor-in-chief or editor. So what are the criteria for desk rejects? We know it could be up to 50 to 60% for a journal, or even higher for high-impact journals. So let's come to Dr. Sarath Chandra first.
So Dr. Chabra, by desk rejects, I presume you mean editorial rejection?
Yeah,
peer review?
rejections before the manuscript goes to through the review process, either by the journal office or directly by the editor.
Yeah, so that's a good question. So currently almost 60 to 70% are editorial rejections in neurology India. And the articles which I would reject is A, it is not relevant to the readership of the journal. So many times you could get articles which are not directly relevant for you, or you feel that it's not going to have a proper readership database. B, the article is, the scientific approach to the article or the statistics provided, they don't match up. So these are something, you won't like to send it to the reviewers and have the reviewers criticize. So when you go through the paper, you can know that the scientific data which has been put is not completely correct. The statistical methods they have done is not very clear. And you feel that, many aspects of the paper has not been properly written, or there has been evidence of some falsifying some data. So these things one comes to know when one reads through the paper. So definitely those are the papers which I would not accept. Thirdly, I wouldn't put it on high on importance, but would be grammar and language. Many times I don't want to keep grammar and language as one of the excuses for rejecting, because that is something which can be corrected. But if the whole paper is filled with grammatical mistakes or language, and then it has not been written as per the journal criteria, so that is initially, so these are the articles where I would send a polite reminder back to them with a technical check that kindly resubmit as per the instructions to authors.
Thank you, Dr. Chandra. Dr. Raju Vash, what do you have to add to this?
Yeah, I would just like to add a few more things about this rejection. I would rather reject a paper where you have a repeated publication of the same topic several times before, and it lacks any novelty, and if it is riddled with high degree of similarity or plagiarism. Here I would caution the authors that many authors feel that once they cite their own work which has been plagiarism, but they must understand the Pope guidelines where it says that no more than 6 words at length should be repeated. And once you publish any paper, it becomes the property of that publisher, and it is no more your property. So you have to take a proper permission if you want to use the information or figure or whatever before. So this is a lack of understanding amongst many authors. We keep getting these questions by email, and so these are the causes of desk rejection.
Yeah, Dr. Sarath Chandra wanted to add a quick comment.
So I just wanted to add this for many of the authors or the people who are listening to this, that nowadays to look for plagiarism, it's very, very straightforward. You have excellent software like the Authenticate, or even if you can do a Google checkup. And many times the author may not be aware that they're actually plagiarizing their article, because when they copy and paste some aspects of discussion, that becomes plagiarized. So that's the reason the author must ensure that they are writing the article right from the scratch. The way generally I advise all the authors to do is, first they should write up their material and methods. This should be followed by the results. This should be followed by introduction and the abstract, and the discussion should be written at the end, so that they're able to cover the proper aspect, and they should write the paper right from the scratch. Because if they don't do that, there is always chances. They would read some papers, they will try to take those data, and unconsciously they may end up plagiarizing, which again would become a area for rejection.
Thank you, Dr. Chandra. So to summarize, the desk rejects may be done by the journal office if it is plagiarized, more than acceptable, or under review at another journal. If the manuscript is not complete, language is not proper, figures are not complete or are not clear enough, or references are incomplete. And it may take place by the editors if it doesn't fit within the aims and scope of the journal, topic is of little significance, standard of writing is too low, or there are problems with the data collection or analysis method where the research does not support the conclusion and there is insufficient novelty. So moving forward quickly, we have this question to Dr. Raju Vaishya. What are the advantages of the open peer review system?
Thank you. Currently, most of the journals are following blind reviews, peer reviews, which may be single or double blind peer reviews, but there have been criticism and some shortcomings of this procedure, and hence the concept of open peer review has come in foray. There are basically three types of open peer reviews. One, where you have open identities. Second, where you have open reports, and third, where you have open participation. The open identities means the author and review know each other. In open reports, the review reports are published with the article, right? And one can see that. And open participation means it is open for all, a wider community which may not be invited can also contribute to review process. There are pros and cons of doing open review. The disadvantages being that disadvantages of blind peer reviews, and or you can say the advantages of open peer reviews. There is lack of transparency in blinded review. There are lack of inconsistencies, and there is wastefulness overall. However, the advantages of open review includes that the reviewer becomes more tactful and constructive and gives a fairly detailed review. There is more honest reviewing, therefore, and there is more or increased transparency in the review process. But the cons of this open review is that there is a bias involved, because you know the author. You tend to accumulate enemies if you give a bad review for a journal, for an article, and it forms a popularity contest where known authors are more than the unknown authors. And hence there are pros and cons. I think only the time will tell how we all or improve the blind review process. I feel blind review process is a good one, but it should be made more robust and transparent.
Thank you, Dr. Raju Vaishya. Dr. Sarachandra, again, apologies, you wanted to comment something on the previous question. A quick comment, we are running out of time, and then your any additions on what Dr. Raju Vaishya has mentioned here. You are muted, Dr. Sarachandra.
The previous comments have been covered by Dr. Vaishya, so I don't have to comment on anything. Now, the open reviews has also been very, very nicely explained by Dr. Vaishya. And definitely, there is something we have to think about it. All I would like to add is there are other things which are coming up. For instance, there are websites which can post your paper before it is published. So even though it's not published, when you write up the paper, you can post them. And this is very, very common for people from the area of physics, from chemistry, from non-biological sciences. So they put the papers on this website, and it is open to a lot of open comments. So open comments and criticism. So anybody can kind of comment, and there would be something like 30 or 40 comments and criticisms. And the advantage of doing it is that a person once puts it on this website, then nobody can plagiarize their work, or nobody can again, publish their work as their own in any other journal. Because this is a threat which is always there with author. An author has done a very, very innovative work. He sends it to the journal. And often when it's a blinded review process, the reviewer knows. I mean, I'm sorry, my apologies, I have to mention certain ugly things. But sometimes the reviewers, because he's blinded, he reads the author's work and he knows that it's good work. He refuses the author's work. And after 3 or 4 months, you find the very same reviewer publishing the same kind of work. So this kind of facilities for putting up the papers on an open forum to show that, yes, he has already done, would be a good protection against, anybody else stealing their work. And nowadays, the journals are also coming up with this platform. For instance, I'm working right now with the editorial manager, and they have suggested that we can put up something like a pre-publication. So any article which has been submitted, which you think is good, you can put it on pre-publication, and it's open to everybody. So even though it cannot be reviewed, but it's there on the pre-publication. So everybody comes to know about that.
So thank you, Dr. Chandra. The pros and cons of the open review process have been brought out very well by both the panelists. Dr. Raju Vaishya also pointed out that we still are in the evolving phase with regard to open reviews, but it may be a step forward. Still, we need more research to be done to prove its superiority over the traditional methods. Right now, there are contradictory publications and views about what is better, the open peer system or elsewise. So I'll now request our panelists to give quick bullet answers. The peer review process remains unstandardized across various journals. Why, and can we standardize it? How can we standardize it? Dr. Sarath Chandra, quickly. You're muted, Dr. Sarath Chandra.
My first suggestion is that the peer reviewing should carry the same academic weightage as writing a paper. So till that becomes acceptable in academic institutes, I don't think we're going to increase the importance for peer reviewing.
Thank you. That's a very important point. Dr. Raju.
I think we should have specialty reviewers that they can do good justice to any paper. The journal should have templates or checklists for the reviewers to follow, so that you get proper answers in elaborate manner, and the review process should be time bound. It should not keep on going. Ideally, I would prefer that the first decision should come in 4 to 6 weeks and no more than that.
Thank you, Dr. Raju Vaishya. There have been attempts to come out with review quality instrument for assessing peer reviews of manuscripts, and this may be one way that we can standardize the review process. So this one, for example, addresses a host of issues like did the reviewer discuss the importance of the research question, discuss the originality of the paper, clearly identify the strengths and weaknesses of the method, make specific useful comments on writing, organization, tables, and figures of the manuscript. Were the comments constructive? Did the reviewer supply appropriate evidence using examples from the paper to substantiate the comments? Did they comment on the author's interpretation of the results? And how would you rate the quality of the review overall? So we can standardize the process, and it is possible. We have had a very interesting session with the two stalwarts. I would only want to let this take-home message go. The peer reviewers have an immense responsibility as gatekeepers of science. Peer reviewing is an evolving process, best learned from experience. So become a responsible, active peer reviewer. I think that's also what our panelists have tried to bring across to the audience. And thank you, Dr. Rajesh and Dr. Sharat Chandra, for joining us today for this session. And I hope the participants have benefited immensely from the knowledge of the stalwarts. Thank you.
Thank you. Thank you very much.
Pleasure,
We have also learned quite a lot from this.
I thank Dr. Chabra and both the panelists for a very insightful session there. It's definitely learning from experiences of stalwarts like you for all the people who are attempting to start reviewing currently. So this brings us to the end of the first day for the panel discussions. We now are going to have the most interesting part about today's most interesting part of today's session is going to be an interactive quiz. All those who are going to see us on OrthoTV, you may please scroll down your screens and you will get a few questions. And I'm going to invite Dr. Pooja Nagpal here. She is a senior scientist at the Indian Spinal Injury Center. She's a PhD and in basic sciences and also an associate editor at JCOT. So Dr. Pooja, you're going to lead for doing the most interactive session for the day for all of us. Thank you so much.
Thanks, Dr. Vanna, for introducing me to the elite audience and the panelists. Definitely, these are the elite audience because they are with us on the Sunday evening till late night. And I am sure they are learning a lot and imbibing the great knowledge as imparted by the panelists. So should we start with the question answer session? May I request the host to show the first question? Can you see the first question on your screen?
Pooja, do you have a PowerPoint you could share?
Yes, sir, I have a PowerPoint. I should.
So I think it will come parallelly on OrthoTV. Vanna, any suggestions?
Yes, I would say that it would be coming parallel. People on OrthoTV will get an opportunity to poll. People on Zoom can right now see it through the presentation from Pooja.
So can you see my slides, sir?
Yeah, can you make it in PowerPoint mode? Just.
Yeah, is it okay?
Right.
Yeah, and we can see the poll on OrthoTV as well.
So let's start with the first question. First question is, what is the responsibility of the elite reviewer? Choice 1 is reporting salami slicing of data. Choice B is check for the similarity score. Choice C is reporting the particular manuscript fall out of the scope of the journal and be published elsewhere. Choice D is taking the final decision on whether to accept or reject the manuscript. And choice E is all of the above. May I request host to share the link, please? Audience can poll now. You have a 30 seconds to poll for the results. Last 10 seconds. So here goes. My host, can you please share the poll results? So answer to this question was is reporting the salami slicing of data. So all of those who are not aware what is the slicing of data, I would like to elaborate is sometimes the manuscripts are big enough and author think of slicing the data slicing the whole manuscript into a multiple publication. So as a standard ethics statement, if the hypothesis, reporting, and the methodology is similar, so you cannot report it into a multiple publication. The reason behind is, if you do so, then reviewer or reader may think of that as the same slice of data has a different population. So that may result into the skewing of the scientific data. So any panelists would like to comment on this? So let's start with the next question. Host, can you please dictate the...
Pooja, if you unshare, they can show the results of how people polled to the first question. Can you unshare for a minute?
Yeah, sure, sir, I do.
You'll need to unshare from.
1 minute, sir. I just pause. Is it? I unshared, sir.
Pooja, you haven't been able to unshare?
No, sir. I've already unshared.
It's still showing as your screen.
You have to go above and say stop share. Yeah.
Yes. So answer to the first question is?
This is the answer to the next question.
I think it's already answered.
89% answered B.
Answer is D. So I'll discuss the next question, sir.
Right, sure. Can you unshare, Ravinder?
Can I make a comment here, Dr. Chabra, if it's okay?
Sure. That's what it is.
So the problem is, whenever a very large study has been done, now people can very easily do a case report, they can do a small original article and all that. But whenever a multi-centric trial has been done, that is where the reviewers become uncomfortable, because moment they start seeing the statistical data, they don't want to go further in it, and immediately they ask for a statistical review. Now, what we must understand is that the statistical reviewers are not clinicians. They can just confirm whether the statistical component is correct or not, and many times it may not be possible also. So that's the reason a reviewer should not, kind of feel that the statistician has got a better answer for this. So they should try to review the article to the best of the capabilities, and the areas which they cannot understand, they can always request the editor to go for a statistical review. But just by saying that it's beyond my scope, please ask for a statistical review right from beginning, is something which should not be done by the reviewer.
Yeah. Can we say that probably if they take the opinion of a statistician, the journal helps them in getting the opinion of a statistician, and then they mold their review accordingly? Would that be a better process, Dr. Sarachan?
Absolutely.
Thank you. Go ahead, Dr. Pooja.
So I'm sharing the screen, sir.
Right.
So we already discussed the third questions. So the next question is, the reviewer's identity is concealed, but the author and the reviewer can have a discussion about the paper on a platform provided by the journal. Which type of peer review is this? Single blind, double blind, collaborative, or cascading? May I request the host to share the link, please, for the poll.
And Dr. Pooja, if you can unshare.
Yeah, I'm doing so.
Yeah, thank you.
I think we got the answers.
So they are still coming. Give it a minute.
Yeah.
You can go ahead, Dr. Pooja, and try and analyze. People are still polling.
They are still pouring. So. I think we stop the poll now.
Yeah.
So as it clearly shows that the answer is C, the collaborative. The collaborative is where the author journal provide the regular platform where the author and the reviewer can discuss the paper and discuss their paper and their choices over there, but they are not knowing to each other and they have to use the platform only. Single blind, we know that only one reviewer knows the author, and in case what is the cascading? It happens when the one manuscript which is already reviewed by one of the publication but is not accepted by the journal and it is transferred to the another publication. So we work on that. That is called cascading of the review. Should we go with another next question?
Sure.
The next question is, the acceptable representation of p-value is greater than or lesser than 0.05, B, p-value 0.00, C, p-value less than 0.05, p-value is equal to 0.012, E is all of the above, F is C and D. May I request host to please share the link for the poll. You have last 10 seconds to respond.
I think we can't see the poll on OrthoTV.
Host, could you please check where we are not able to see?
Now it's visible. It's visible now.
Please go ahead, Pooja.
So I'll give it 10 more seconds for it.
Okay. Yeah.
So should we stop the poll, please? So answer is, so most of the people have answered correctly. It is F. It's a F answer, that is both C and D are the correct. A is wrong because I'll share the screen 1 minute.
Ravinder, stop. Yeah.
I think people got the C right, but they did not get the D option right, and the correct answer was C and D both. When the p-value is less than 0.25, but it's a particular number, you can state it completely.
Can I make a comment here, Dr. Chabra?
Sure, sir.
See, in my opinion, the p-value is the biggest red herring for any article. So moment a person mentions the p-value, suddenly everybody thinks that all the statistics are completely robust. So that's the reason it has to be seen holistically. Confidence interval is something which has to be mentioned, not just the p-value. And similarly, the entire statistics has to be seen in totality. So just mentioning a p-value doesn't mean that everything is absolutely verified.
Totally agree with you, sir.
Totally agree, Dr. Sir. Shall we move on to the next question?
Sure.
1 minute. Can you see my screen, sir?
Yeah. Could you make it PowerPoint?
Yes. So next question is, what are the advantages of reviewing a manuscript? A is value adds-on offered by the journal like complementary access. B, monetary benefits. C, increase academic visibility. D, Help for those aspiring to join editorial board membership of the journal. E, no benefit. F, only A, C, and D. Host, could you please share the question and the link for the comments?
I think it is value adds that we need to work on. And as Dr. Sarat Chandra said, we need to emphasize and make it as important as writing a manuscript.
Yeah, the same, I believe, in the previous panel group, we have already discussed it. Let the people ask.
Could I make a comment here, Dr. Chabra?
Sure, Sarat, please go ahead.
Yes.
See, as personally for me, reviewing has become the biggest source of knowledge seeking.
Right.
So when one reviews the article, goes through it, that is the best way you can keep up to date. It is a very, very gruesome process. You have to go through it, but it's the most wonderful way for you to keep in touch. So I think for people reviewing, that's the best way for them to keep up to date, especially you become a consultant, and you may not have the opportunity to go on reading each and every new article. So reviewing an article is the best way for you to keep in touch.
Totally agree with you. And that's also listed here, I think. Right, Pooja, go ahead.
So that's the answer question, sir. 5 questions we have already discussed over here in the interactive session. So, so now, as you are all aware, we have already shared some of the questions through Monkey survey also. So I'm going to discuss those questions in the benefit of all the participants, and also share the names of the winners of the contest. So may I share the slides, sir?
Please go ahead.
Can all mute my screen?
No, you need to share screen.
1 minute. Can you?
I can see it now.
See it right now? Yes. So we have shared some of the question with the through the Monkey survey with the participants, so they can have a pretext what kind of discussion will we have in the panels. So I'm discussing these questions. First question was, as a reviewer, you have given a major revision for an article. The author has resubmitted the article after the revision, but those revisions are not as per your expectation. What should you do? A, again, send the article for revision. B, accept them for approved for publication. C, send to the editor with your remarks and leave it to the editor for decision. So answer to this is send to the editor with remarks and leave it to the editor for the decision. Here I would like to comment on that the responsibility of the reviewer is to give their judgment on the scientific content of the paper and comprehend all the comments to the editor. So it's a responsibility of the editor to judge based on the different reviewers' comments to whether to accept it or not to accept it. So I'm going to the next question. The next question was, the authors of the manuscript mentioned low sample size as a limitation of the study. Please comment as a reviewer. I request some of the panelists, could you please would like to comment on this? Dr. Gayatri, would you like to comment?
Yeah, thank you for giving me this opportunity to answer this question. Yeah, definitely. Low sample size, we cannot comment because we do different kinds of studies, in original articles. So it depends on the study design as well, because in surgery, we cannot have number of patients as compared to the pharmacological trials. So that is one thing we need to see the study design. If it is a retrospective cohort study, definitely you have to have a good number of, subjects for your study. So if you are quoting just like low sample size, because it may have the low statistical power, it may have falsified, type 2 errors. It can also inflate your estimation of effect size. So you can overestimate or you can underestimate your sample size. So there is a low reproducibility, number of causes are there. But with this, you have to look at the study design, So these are the things, you cannot just only mention the limitation as we have the low sample size. That is not correct.
Thank you, Dr. Gayatri, for your comments.
Could I make a comment, Dr. Chabra, if
Yes, sir, please.
may be allowed?
Yes.
I would like to mention that there is a formula to correct your sample size. There's a formula to calculate your sample size.
Yeah.
So before you undergo a study, especially a prospective study, you should discuss with the statistician and they will help you to come out with a sample size which is kind of expected to give you that answer.
I agree with you, sir, but if we see on the perspective of reviewer, sometimes some publications come with this kind of statement. So how reviewer should respond to that, that would be added.
You're right. I think the way the reviewer should respond is depending upon the importance of the study. If it is a very unique study, it is has got a lot of novelty, it's going to bring out something new for the first time. That's when the study becomes important, even with a low sample size. But then it's not going to add anything much to the existing literature. Publishing something with a low sample size, is something which may not be worth publishing.
Right.
It has to be taken in context with the type of the paper which is being expected for publication.
So that means you should mainly see the novelty of the paper. Low sample size is definitely a major mistake, major flaw in the study, but you should not reject totally based on the low sample size. That's what you wanted to comprehend, sir?
Absolutely.
Yeah. So let's go to the next question. The discussion of the manuscript contained inappropriate interpretation of the results. They seem to be making claims that are extrapolating on the results of the study. You think of them as a speculation, not backing by the data. You will comment it as minor revision or major revision. Any panelist would like to comment on it?
So I would like to say that this is a very, very important question. And it happens if the reviewers do not read through the discussion carefully. So most often, they go through the results and then discussion, they would superficially glance, they won't give much importance. And what happens is, even though in the results you mention something like an X amount, but in results, in the discussion, you kind of extrapolate it to X plus Y. You say because, and that is something very, very dangerous. That can lead to a false interpretations and should be avoided at all circumstances. So I would suggest that it should be a major revision. So this kind of interpretation should never be given.
Agreed, sir. Agreed. Very, very well said, sir. So next question is, so answer is B, major revision. Question 4 is, as a reviewer, you have given a major revision for an article. The author has resubmitted the article after revision, but those revisions are not as per your expectation. What should you do? It happens many times. You give the revision to the author with the comments, but the again revision comes to you and you wanted to know how to comment on them. So choices are: again send the article for revision, B, accept them and approve for publication, C, send to the editor with your remarks and leave it to the editor for the decision. Dr. Vandana, would you like to say something on it?
As we talked about it, having an open conversation with the editor is the best route. The answer should be C.
Yeah, you're correct, because it is definitely our editor's decision which need to be which is taken part based on the 2 or 3 reviewers' comments. So let's leave it to the editor to decide on whether to go ahead with the publication or not. Question 5, as a reviewer, you come across a scenario where data presented in table and graph does not match that in the text. You should put it as a minor revision or major revision. As we already discussed, I think in the previous panel, if there's a flaws with the tables and graphs, so definitely it will go for a major revision. Kindly give comments on the given figure. May I request Vandana to comment on that?
Thanks, Dr. Pooja. Yes, I think we covered this in the talk. People tend to add a lot of chart clutter. This is a three-dimensional plot. We don't need 3D. Sometimes 2D plots too, as well as that. Others. We got some very good replies from the SurveyMonkey. People really analyzed this data and even questioned the authenticity of this data.
Right.
The choice of the graphs, the size of the fonts, the type of the fonts. I think there's a lot of detail that needs to go while making your graphs. And there are good resources available for authors and reviewers, like open package like R, which makes good charts. So I think making good graphs is an important component of writing a good article, and reviewers always pick out mistakes there, and rightly so, I would say, because the figures should stand on their own while describing the results.
Yeah, I see one more problem with this chart is that there's a very close interval they have taken in the data set, which can be avoided into it. So there's excessive detailing of data. Data can be represented with more clarity using 2D histogram chart, and there's no requirement of 3D charts. Moving on to the next question, while reviewing an article by author from a very prestigious institute, you suspect that some of the data are falsified. How would you report it? The choice is the author should be questioned about their intent and should be given a chance to explain. B, the ethical breach should be directly reported to the confidential comments to the editor. I'll open it to the panelists. Dr. Sarat, would you like to comment on it? So let me take it to this. Yeah, please, sir.
I'm sorry, I just moved away from the laptop. Just give me a couple of seconds to go through the question. Yeah, this is a situation one comes across not very uncommonly, and I think the best way to tackle is that the editor, before sending it to the reviewers, should directly read through it and directly send it back to the author, expressing his opinion. That is what I would do. And I would not send the article to the reviewer. I would send it back to the author, and then I would ask the author to. But of course, the question here is,
if it comes to the reviewer.
It's already been sent to the reviewer.
Yes.
So it should be reported as confidential comments to the editor.
Right.
Obviously.
Definitely, because it is an ethical breach and it cannot be taken up lightly. So it has to be put up to the editor. Right. The answer is the ethical breach should be directly reported to the confidential comments to the editor. So next question is, while reviewing paper, you detect that introduction is copied verbatim from one of the author's previous publication. What would be the right course of action for you? A is recommend the rejection on account of self-plagiarism. B, write to the author to get explanation, point to the editor and include the comments to the author. I think this has already been discussed in the previous panel. Answer should be point to the editor and include in comments to the author.
Dr. Pooja, I'm just going to interrupt here. Sorry.
It should not reach the reviewer, right?
Yes, in fact, that was one of the questions from the audience as well, that how do reviewers, as a reviewer, how would you do a plagiarism check? So that's where I think you should point out that plagiarism checks is being done by the journal offices using softwares. So reviewers themselves do not need to have access to those softwares to do plagiarism check usually. It was a question from the audience and I thought I should clarify it right now.
Yeah, but sometimes the journal office may miss and you may land up in this situation. So then what one should do? So that's the question. But in a good system, this should not happen.
Right, sir. Thank you, Dr. Next question is, you're reviewing a manuscript where the study does not prove the author's hypothesis. If the question was important and the answer is valid, then it does not matter if the answer is negative or boring. So choices are true, even negative results should be accepted for publication. B, false, negative results are useless. It's a tricky question. Not many times we do think of that it has to be the real result. Something should come out of the study. But there are some studies which happens, do not result or prove their hypothesis and come out with nothing into it. But that I don't agree with that it should not be presented into the publication, because negative results are also the important result. It give some pointer to the other researcher that it might not work in this way, that you have to change your material, your maybe a hypothesis or maybe process of doing things. Any would like to comment on it?
Could I make a comment whenever you think it's okay?
Yeah, sure, sir. Definitely.
So I like to point out two things. First of all, if you look, there is a journal called Journal for Negative Results.
Right, sir.
So it accepts only negative results.
Negative results, agree.
And if you look at point number 2, some of the biggest studies, most important studies, are studies which have had negative results. In neurosurgical surgery, particularly, I like to point out for a randomized controlled trial for intracerebral hematomas, which was done by Newcastle upon Tyne, UK, funded by the Medical Research Council. And a lot of people all over the world participated, and we recruited 1,000 patients. And ultimately, the result was neither surgery, neither medical treatment, they don't have much of difference. So that was a very, very important. So some of the most important studies have negative results. So over here, it's very important for the editor to take a decision that if the results are negative, is it still worth publishing in their journal? And one should not be, the author should not be afraid of pointing out negative results. If there are still negative results, they should still go ahead and send it for publication.
Agreed, sir. Definitely. But sometime in an author's mindset, the people they do think I don't have a good result, I should not be publishing into higher journal, or maybe they are not taking up. And I definitely say editor should take into the consideration that negative results are also as important as the positive results.
So here you're absolutely right. So here the packaging is very, very important. So the author has to learn the art of packaging his article and how he is or she is actually presenting the article to the editor. So if they say that, we didn't find anything, we don't think it's of, then obviously the editor may. But at the same time, if the author is able to show that by showing we have negative results, we have shown that these are the things which are not possible. So perhaps there is some other possibility.
Thank you, sir. The next question is the title of the study designed to find differences before and after surgery in population undergoing total knee arthroplasty is given as radiological assessment of the subject undergoing TK in India. Give your comment as a reviewer. Anybody like to comment on it? Dr. Vaishya, if you would like to comment on it. I think
Dr. Vaishya had to leave early.
Okay. I would like to comment on it like this. The title of the article does not give right perspectives of the study in the manuscript. It's incomplete title. It do not define the study design or type of the study.
I think the more important thing is absolutely no abbreviations in the title.
Yeah.
You cannot give abbreviations in the title.
TK is cannot be used as an abbreviation. Right, sir. So last question is, the reviewer's responsibility is to point out the problem areas of the manuscript. How to fix a problem is up to the author. True or false? Vanna, would you like to say something? True or false?
False. You tell them constructively how to improve. So.
Yeah. Correct answer is this. So with this, we end the SurveyMonkey's question answer series. So I'm now, people are waiting who is the winner of this session. So answer is, winners are Dr. Rajiv Maharajan, Dr. Sameer Mehra, Dr. Srinivasanulu Metikala, and Dr. Mayank Garg. Very congratulations to all of the winners. You will be getting your certificates very soon. With this, I switch over to Dr. Vandana for
Thank you so much, Dr. Pooja. Yes, so that was some interactive session we did offline and online. We'll be doing another activity, and to all the listeners on OrthoTV and Zoom today, we will be circulating an article for you to review. It'll give you hands-on opportunity to learn how to review an article. So we'll give you a dummy article to review, and we'll give you up to 5 days to complete the review and send the results back to us. We'll be giving out the results of the review from some elite reviewers present over here and share those results again with you. So it gives you an opportunity to see how reviews were done by the people who are more experienced, the stalwarts, right? That brings us to the end of today's session, and I want to thank everybody who participated actively and made this session so enjoyable and so insightful for everyone to learn from. Dr. Chawla, would you like to say any last few words before we end the sessions today?
Yeah, I would want to thank especially all participants and especially all panelists and our keynote speaker for contributing to this webinar, which I think has been excellent. The recording for this webinar would be available on the JCOT site later, so that those who would want to go through again, and some of those who could not participate would want to go through later. So this would be available on the JCOT website for you to view later. I would want especially to thank Delhi Orthopaedic Association, its executive, and the president, Dr. Atul Vaish, who is present with us here and who has been there throughout the webinar. So we thank them for the opportunity to have a wonderful journal and for such activities and such initiatives. We can only reassure you that we'll do anything and everything to take this journal to newer heights, especially since we have the wholehearted support for so many by so many experts from across the globe, and also friends like Dr. Sarat Chandra and the executive, and also now internationally through friends like Dr. Schroeder, Dr. Vaccaro, Dr. Michael Failings, and others. So do join us next week again, 6:30 p.m., where we will start with a keynote address by another stalwart, one of the most prolific authors, Dr. Michael Failings, who will be talking on what does an author expect from a reviewer. So it would be very useful to listen from him. He's a colleague and has contributed immensely to science. So thank you, everybody. Thank you, all participants. Thank you, all the faculty, and especially very special thanks to everybody who contributed towards organizing the webinar. Especially Dr. Gayatri, Dr. Vandana, Dr. Pooja, and there are a lot of people who have also worked behind the scenes, and the editorial board of JCOT for this wonderful webinar. And we have committees now, so this committee will be very active and will be taking these such sessions forward for all of you.